there are some board members, as I've indicated, that are participating virtually as well as members of the public. And so for those that are attending virtually, please mute your phone or computer so that it doesn't interrupt when others are speaking. Just to remind board members that and presenters that please identify yourselves whenever you speak so that those virtually will know who it is that is speaking. With that, I believe let's go right to roll call.
Yes, Lieutenant Governor Howie Morales. State Treasurer Laura Montoya.
Good morning, present.
Good morning. Member Michael Sanchez.
I'm here.
Member Paul Cassidy.
Present.
Member Wendy Trevisani.
Present, good morning.
Good morning. Member Joseph Lujan.
Present.
You have a quorum.
Thank you. With that, let's go to the approval of today's agenda. Do we have a motion to approve the agenda for today?
So moved.
A second?
We have a motion to approve the agenda by member Montoya, a second by member Trevisani. Would you please call the roll?
Yes, Treasurer Montoya.
Yes.
Member Sanchez.
Yes.
Member Cassidy.
Abstain.
Abstain. Member Trevisani.
Yes.
Member Lujan.
Abstain.
Abstain. Motion passes.
And with that, let's go to item number 3, the approval of the minutes of May 20th of 2025. Do we have a motion to approve the minutes of May 20th, 2025, regular meeting? Full approval, Mr. Chair. We have a motion to approve by member Cassidy, a second by member Lujan. Would you please call the roll?
Yes, Treasurer Montoya.
Abstain.
Abstain. Member Sanchez.
Yes.
Member Cassidy.
Yes.
Member Trevisani.
Yes.
Member Lujan.
Yes.
Motion passes.
Thank you. With that, let's go to item number 4, the consent agenda, items number 4 through 15.
Yes,
If you're ready.
Yes, Mr. Chair, members, good morning. I will now read through the consent agenda before you today. As you mentioned, Mr. Chair, this is items 4 through 15, all action items. And if you're following on in your board books, this begins on page 24. So the first item on consent has been submitted by Otero County. Otero County is requesting approval of the lease of real property located at 301 Texas Avenue in Alamogordo to children in need of services. This is for consideration of $135,261 per year with services in lieu of rent contemplated. If approved, approval would be contingent upon the directors and council's receipt of a fully executed lease agreement. Moving on to item number 5. Item number 5 has been submitted by McKinley County. McKinley County is requesting approval of the lease of real property located at 300 West Nunoni Boulevard, Suite A in Gallup to the Navajo Nation Division of Behavioral and Mental Health Services for a consideration of $405,645 per year. If approved, approval would be contingent upon the directors and council's receipt of a revised and fully executed lease agreement and a corrected resolution of the county commission evidencing approval of the lease. Items number 6 through 8 have been submitted by Los Alamos Public Schools. Item number 6 is a request for approval of the lease of real property located at 1104 4th Street in Los Alamos to Triad National Security LLC for consideration of $935,577 per year. If approved, approval would be contingent upon the directors and council's receipt and review of a fully executed lease agreement. Item number 7 is a request for approval of the lease of real property located at 4000 University Drive, Building 6 in Los Alamos to Triad National Security for $297,054 per year. And as with the previous item, if approved, approval would be contingent upon the directors and council's receipt of a review of a fully executed lease agreement. The last item from Los Alamos Public Schools is item number 8. This is a request for approval of the lease of real property located at 3400 Arizona Street in Los Alamos to Triad National Security. This is for $1,073,754 per year, contingent upon director and council's receipt and review of a fully executed lease agreement. Moving on to item number 9. Item number 9 has been submitted by Cibola County. Cibola is requesting approval of the sale of their property located at 700 East Roosevelt in Grants to Blues NMGR LLC for $570,000. If approved, approval would be contingent upon the directors and council's receipt and review of a fully executed purchase agreement and a fully executed quitclaim deed. Moving on to item number 10, this is from the University of New Mexico. This is a request for approval of capital expenditures for construction of the Doña Ana County Clinic for $8,969,640. Item number 11 has been submitted by Housing New Mexico. This is a request for an extension of its single-family housing 2025 private activity bond volume cap allocation, and that's for $4,096,716.68. Item number 12 has been submitted by Bernalillo County. Bernalillo County is requesting an extension of its private activity bond volume cap allocation for the Casitas del Camino Apartments project in Albuquerque for $16.5 million. Item number 13 has been submitted by the New Mexico Educational Retirement Board. ERB is requesting approval of an amendment, change order number 2, to the contract with Enterprise Builders Corporation for the construction of the ERB headquarters. Those are located at 5211 Las Soleras Drive in Santa Fe, and that's for a total contract amount of $12,750,664.96. If approved, approval would be contingent upon the directors and council's receipt of that fully executed change order number 2. Item number 14 has been submitted by the General Services Department. This is the annual schedule of repairs for July 1, 2025 through December 31st, 2025. And then item number 15 has been submitted by staff. This is a request for approval of a contract for professional services for rulemaking with delegation to staff to finalize the contract and submit to the Contracts Review Bureau for approval. This contract would be with the Rody Law Firm, continuing the work done under the fiscal year 25 contract. And with that, Mr. Chair, that concludes the consent agenda.
Thank you very much, Ashley. Any questions or comments by committee members? Ashley, is there anything?
No, Mr. Chair.
With that, is there a motion to adopt consent items number 4 through 15 with those items that have the contingency on them as well? Do we have a motion to adopt?
Move approval with the stated contingencies.
We have a motion to approve by member Trevasani, a second by
I'll second the motion.
member Montoya. Would you please call the roll?
Yes, Treasurer Montoya,
Yes.
Member Sanchez,
Yes.
Member Cassidy,
Stay.
abstain. Member Trevisani,
Yes.
Member Lujan,
Abstain.
abstain. Motion passes.
Thank you. With that, let's go to item number 16. I think it's a presentation.
It is, Mr. Chair. I believe we're creating individuals.
Presentation by the University of New Mexico on the medical school construction enrollment and retention efforts. Good morning. Please identify yourselves and we'll start with that.
Chairman, I'm Garnet Stickles, president at the University of New Mexico, and I'm here with Mike Richards, who is our executive vice president.
Good morning and welcome.
Thank you. So we get started.
Anytime you're ready.
All right, thank you very much. We're really delighted to be here today. We are here to just share with you our views on the future of healthcare in the state. We have a bold and transformative initiative for UNM to significantly expand our role in providing access to healthcare and in the state of New Mexico. And I will say, I'm here because, you know, this is an institutional priority, but it's really significantly more than that. It's really a commitment to ensuring that every New Mexican has access to healthcare, regardless of where they are. And we all know the issues with access to healthcare. We've all had that experience, not being able to get primary care, not being able to get in for specialty appointments. And, you know, I have the privilege of living in a city where there's more access to healthcare than many places in the state. But I know how personal this has become. And at the university, we've become very aware of how important our role can be in meeting the needs of the state. We have a unique role given what we've done in the state. I mean, there's so many things where, if you need to see a physician, depending upon what it is, it's likely that you will see someone at UNM at some point. And so, we have decided that we'll make a promise, that what we're doing is in fact, indeed to serve the state of New Mexico and its healthcare workforce needs. So you have in front of you this little document, and what it has in it are the slides that I'm going to cover. If you go to slide 2, and these are printed front back, if you look on the bottom right-hand corner, when I refer to slide numbers, you'll see this little number 2. So that little number will tell you what slide we're actually on. And really this second slide is just letting you know what our agenda is, what we're going to be talking about. It's the third slide that reflects the university's call to action that I've just referenced. I think that, you know, it's interesting to realize that strengthening our healthcare system and strengthening our School of Medicine actually and having a medical school expansion actually ends up strengthening the entire institution. What this initiative will do is create transformative pathways for undergraduates to be able to pursue medical degrees and other healthcare degrees. We need those pathways to be seamless. It will, by expanding our dual degree options and fostering opportunities in interdisciplinary studies, we can align the educational opportunities that exist with our healthcare sector. And I think as a nationally recognized Hispanic serving and minority serving university, our collaborative pathway programs are really invaluable and important contributors to workforce expansion in the state of New Mexico. I think too that the research collaborations will allow us to more effectively look into healthcare issues that exist across the state. And it will allow for greater connections and allow us to attract more top talent to the institution and to the medical school and the healthcare system. On the next slide, you see a glance at where we've been. I don't want to forget that, in fact, we're not starting from scratch with this proposal. We've had a lot of programs in place. There's been a lot of hard work, a lot of extensive accomplishments, and this gives you a snapshot of what we've done in our healthcare system. Over 1 million patient visits. You can see how many emergency care visits on the slide. You see kind of the impact on our diverse populations. You see the extent to which we've driven research and workforce expansion. And what's interesting is these numbers are really for research. They're from FY23. In fact, our numbers have gone up close to 400 million since that time, without mentioning the impact of NIH and NSF things going on federally. We don't know what the future holds, but we have been on an upward trajectory with our health-related research at UNM. On slide 5, you see something that describes really how complex the community needs are. And I feel like I'm probably speaking to people who already know these things. I don't want to say too much. I feel like you actually know this. But in terms of access to care, 32 of our 33 counties are designated health professional shortage areas. Looking at community needs, you see the focus on our aging population and its impact. And and the fact that so many people in the state are spread across the rural areas, where access to healthcare is limited. Our birth rates are declining, and we have serious issues with substance use disorders and mental and behavioral health issues. You also see some of the challenges related to educational delivery. The fact that our ability to expand our programs is seriously hampered by a limited number of clinical training slots and access to the clinical infrastructure that is an essential component of our success. Our School of Medicine doesn't really have the physical capacity at this time to accommodate larger practices. And we have a lot of work to do to really build the system that's going to be essential to success. On the next slide, slide 6, you can see that there are many things that we need to focus on. I just want to say we are committed to improving healthcare access and outcomes. And it's not limited to the clinical and educational advancement. It really extends to research and innovation in the state. And I think because we're a healthcare system within a university, we are in a position to be at the frontier of so many things in healthcare and find solutions that can improve the outcomes for New Mexicans. So excellence in health education, driving innovation through research, strengthening the health professions workforce. These are all things that we are committed to because we recognize their importance for the state. Many of you may know that we have a 2040 plan at the institution, opportunity to define. It kind of sets our sights for where we're headed, both in the short term but in the long run. But goal 1 for the university is advancing New Mexico. And this is a critical component of how we do this. This is where our institution can have tremendous impact in improving outcomes in the state. And what you see in slide 7 is the stark reality of the kinds of shortages that are expected in healthcare. The ones we see as of today in 2024, how many practitioners are needed across a number of health professions, including the physician workforce. But you see those big areas where we've also been doing some work, but you see other areas where those numbers are increasing in most cases in terms of projections over what New Mexico will need by the year 2035. The next slide, slide 8, is really focused on the national challenge and the comparison of New Mexico. You know, one of the things I've really appreciated about working with Dr. Richards is that I discovered really how complicated this problem has become. You know, there's a shortage of physician workforces and healthcare workforces across the country. So, you know, sometimes the numbers don't look so discrepant, but the reality is because of so many things that are true here in New Mexico, the challenges for us are going to be greater. That aging population is one aspect of that. The rural nature of the state, you know, how big the state is, creates greater challenges. The fact that our birth rate is less than our death rate is a significant challenge for the future. You can see at the bottom of slide 8 that we've mentioned the number of beds per 1,000. We see that New Mexico beds are less than that were ranked 48, that there were 31% below the benchmark. But there's a lot more going on than this. If you look at the next slide, you find that our comparison of our existing physician workforce, there are things happening in healthcare that are influencing us and influencing healthcare across the country. The shift away from private practice. There are economic and administrative and regulatory pressures that are contributing to that. And what we come to understand is that what we're in desperate need of is the infrastructure that allows us to actually hire physicians and have them able to work. Physicians more and more are needing to be in facilities and have the infrastructure in order to practice. And that's driven by, you know, as so many things, administrative issues, economic issues, and regulatory pressures. And so you see some of the trends as of 2024 that are having an impact. So with that, what I'd like to do then is just turn this right over to Mike, who may clarify a couple things I've said, but then really dig deep into this important project.
All right. Well, thank you, board members, and thank you, President Stokes. And so picking up on some of the key messages from President Stokes. In my job as Executive Vice President, the President and I have really set a goal to double the size of the health profession training programs. Really to help, that's the role that we can play to help on the healthcare workforce issue. But another really important point brought out by President Stokes is that infrastructure plays a huge piece in this. If we're thinking about meeting this healthcare demand, it's not just the people, it's the infrastructure. And you'll see in just a moment at how important that has been for us being able to put those two things together to be able to work on this problem. When we start on page 11 and 12, we bring all of our major capital projects to here, and we're so grateful for the support that we receive for those major capital projects. But the reality is that we haven't really made significant changes in the size of the UNM Health System clinical footprint since 2007. That's going to be very different starting on October 5th of this year, when we have the grand opening and start seeing our very first patient in the new critical care tower. Okay, and that has been part of an ongoing effort to build infrastructure for both the clinical delivery system and the education component. And so on the educational side, you've helped support us, expanding the College of Nursing and the College of Pharmacy and the College of Population Health. And so on our goal to doubling the size of those educational programs, we're making great progress. In fact, the enrollment for the nursing program this year is up over 35%. So we will hit those 10-year targets. But we do have a bigger issue when it comes to the School of Medicine. And one of the issues is that we have to have the infrastructure. On slide 11 or slide 12, you will see that with the opening of the new hospital tower, that we will then be able to start to see significantly more patients, and that over approximately the next 10 years, we have about an 80% increase in the size of our inpatient capacity and more than a 50% increase of our outpatient capacity. That becomes critical to this conversation because over the last 15 years, we have saturated the current clinical delivery system with learners. So we haven't been able to grow the programs more because healthcare professional students have to have a clinical environment in order to train. And so once that clinical environment is full of learners, then we actually can't expand the programs anymore because they have to have access to the patients. We have to be able to meet the accreditation standards. But with this new changing of the clinical delivery system size, we'll now have the opportunity to increase the size of these educational programs to meet this goal. On slide 14, though, we do make a moment to just pause to say, while we're talking about the School of Medicine program today, we actually start thinking much, much sooner than that. For us to really ensure that we're offering this opportunity for New Mexican students who want a health professions career, a big part of what we've got to do is help them understand that this is an option for them. And so we think about our K through 12 programs and how we can get into the community to make sure that they're both aware that these programs are available and that we can help support local communities to prepare these students for the rigors of a health professions training program. But one of the rate limiting steps for us beyond the clinical delivery system, which we are in fact fixing and will be very different starting here, in October, is the fact that the current School of Medicine infrastructure has really reached the end of its life. So the main building that we use to support the School of Medicine is called Fitz Hall. It's built in 1967 and using construction and technologies that really make it not amenable for remodeling or expansion. And after extensive evaluation, we've determined that it really is a building that must be replaced to support the School of Medicine. As part of this process, which we started last year, we implemented a set of key steps, starting with the assessment that Dr. Stokes, President Stokes talked about around the state need. Then working with Secretary Rodriguez, we did a business plan for the School of Medicine, which looked out over 10 years. if we line up the clinical growth, we line up the need of New Mexico, the accreditation requirements, is it really possible and feasible to double the size of the School of Medicine? Can we put a pro forma together that would show what that would look like over a 10-year horizon? We then use that pro forma, then do another step, which was to then do a fiscal analysis of the impact of the state of New Mexico and an economic impact. And then using both of those items, then to do what we refer to as a facility programming, where, and I'll talk about both of these in a bit more detail, but really looking at the future programmatic needs of the School of Medicine, driving what the new fiscal plan would look like as the way we would do it. The timeline of that, which starts on page 16, really was completing the business plan in 24, which we've done, and I've included an executive summary in your packet. Completing the programming work, which we also did to be able to help drive the design work, which we've also recently completed. Then to support a legislative request that we had this year for $30 million for the design of the new School of Medicine facility. Very pleased that that appropriation was given to the university, and we're now closing out the RFP process for that design and architectural work. And so you'll see here that we'll be making the decision on that design partner within the next couple of weeks. Also on page 18, another big piece of this is that if Fitz Hall is at the end of its life, thinking about how we transition out of Fitz Hall and deal with that facility, given it is a very complex medical education building that's in the central part of the Health Sciences Center campus. How would we decommission that building and still maintain continuity of operations, given the infrastructure connection of that building to all of the other buildings on the Health Sciences Center campus? For example, it's not apparent when you're actually looking at it, but there's a complex network of tunnel systems that bridge all of those buildings together, which largely support both the mechanicals and facilities, but also the research enterprise. So that's also been underway right now. And so we hope to have that analysis done by September of 25. Starting on page 19, I'd just like to mention just a few of the highlights of the business plan that we did for the School of Medicine. We engaged a partner called ECG Medical Consultants for this. They're a nationally known company that's worked with over 90% of the schools of medicine in the United States. And really this kind of idea of expanding or building or creating new medical schools is actually one of their areas of real expertise. And on slide 20, we start to look at some of the kinds of data that they were able to do for us. Like, for example, a couple of key points here is that when we look at the number of allopathic medical school seats, which is the degree that's the medical degree, MD degree, that New Mexico has about 20 per 100,000. The national average is 30, and states which are aggressively building their workforce move to 40 or more. And so us doubling the size would take us to 40, which puts us in that same group that's working on growing their workforce. Another really important point I want to note here is that 95% of all of the matriculants or the entrants into our School of Medicine come from the state of New Mexico. Those other 5%, they are generally students who are part of the Western States Consortium that we're a part of, so that they get in-state consideration, or they're Native American students who also get in-state consideration. So this really is an opportunity for us to say, our commitment isn't just to grow these educational programs, but to grow them for New Mexico students, to give them the opportunity. On slide 21, the really important point here that I want to note is that there are 3 bars on here. The teal bar in the middle is the size of the School of Medicine. And so over this 10-year period, we would double the size of the School of Medicine MD programs. But you do see that it really does require the new infrastructure and the opening of the tower for us to be able to do that. However, something that we don't always talk about is that our School of Medicine is also the training program and the site for almost all of our other healthcare professionals, with the exception of nursing, pharmacy, and public health. So physical therapy, occupational therapy, radiation technology, EMS, all of those students are part of the School of Medicine. And so we have generally about 700 of those students in the School of Medicine. And so when we talk about doubling the size of the School of Medicine classes, we are in fact talking about doubling the size of those health professional programs also. And then the last bar down there are the biomedical scientists. Starting on page 22 and 23, the key message here is that growing the clinical delivery system, and which we talked about early on as we grow the clinical tower and start to move into that physical plan, means that we now have the opportunity to recruit more physicians to deliver that care. And we expect that as we fully utilize that physical plan, that we will need to recruit about 300 to 350 more physicians to be able to deliver care in the UNM health system. Those physicians can be the faculty members at the School of Medicine. That gives us both the opportunity to deliver the care. It also gives us the economic model to be able to support those 350 physicians. That's why this is such a unique opportunity for us, because the timing of the growing of the tower, the need to recruit the physicians, the need of the state, all come together to make this, this unique moment in time for us. On slide 23, a key point is that while we will be doubling the other educational programs, we don't actually have to double the size of those faculty members to do it. On 24, we look at the 10-year pro forma for the school, and the main conclusion here is that this is completely within our reach. The economic growth of the clinical delivery system more than covers 85 to 90% of the cost of being able to have supporting the ongoing operations of this doubling of the school. On the last couple of slides on 25 and 26, we really look at the value of this to the state of New Mexico. And what you see here is that our School of Medicine cost, as compared to other public schools of medicine, that our tuition is about half that of the national average. And when we look at state support for the School of Medicine, that we come in right at or just below the national average for the amount of spending per student. Again, what we believe is this demonstrates that it's a good value for the state of New Mexico. And then on 27, we see the economic impact. This economic impact slide is only for the incremental increase in the School of Medicine. This is not the full economic impact of the Health Sciences Center or the clinical delivery system, which would be more like about $6.5 to $7 billion annually. And as we start to conclude here, I just want to just mention the programming work that was done. And this really was, how do we know what size building that we need to support contemporary medical education and science, and where would we put it so that we could use that as part of the design and architectural process? And for that, we engaged a group called Page Sutherland Page, and with the goal that we would want the first medical school graduating class out of this building in 2034, which would mean that we would need to have the building open by July of 2029. With that in mind, we went through an extensive process that engaged the community to determine where this building would ideally be located. And on slide 33, you see that our intended location is to put the building on the corner of University and Lomas. That becomes then a gateway to the University of New Mexico, but it also is really important because that corner on that slide you'll see is in relatively close proximation to the new hospital tower. And when we build our next medical office building, it will be in that yellow box in between the new School of Medicine and the hospital tower. That gives us the adjacency for the faculty and the students to be able to move from the classroom to the clinic to the hospital with the greatest efficiency, and to be able to support that continuity of their operations. As part of the programming work, we really relied very heavily on national benchmarking data to make sure that we were building a contemporary building that was consistent with what was being done with our peer organizations. And you'll see here that when we land on this, that we believe we can do this at a slightly better than the national average on square foot per learner. And then starting on page 36 to 37, you'll start to see some pictures of other medical school facilities which have recently been built that kind of show what contemporary classroom space looks like. Or on slide 37, what contemporary laboratory space in an educational building looks like. The concepts are much more open, much more modular, far more flexible than the kind of small labs that we were building 50 years ago. And then on 39 and page 38, you see that simulation becomes a huge part of this process, and education, and that ultimately think of this building, you know, for supporting overall other activities at the campus, not just education. So we look to have high flexibility. And then I'll take you all the way to page 43, which gets us to the place where we are now on the capital request for the building, which we'll be working in this interim session and then this next legislative session to determine what is the right way to fund the capital portion of this project. You'll see that it's a very expensive building, but what we've been able to do is to show that this is exactly what the building are costing now as compared to our national peers. You know, we believe that with the extensive programming work that this is a 350,000 square foot building that will come in at right now when priced is using the 2025 data at about $600,000. With that, Mr. Chair, we'll stop and we'll be pleased to answer questions.
Thank you, Dr. Ritchie. I appreciate the presentation of both of you. Thank you. Questions or comments by committee members? Member Farasani.
Mr. Chair, thank you, President Rosen, Dr. Richards. I appreciate this. It's a topic pretty near and dear to my heart. I do a lot with healthcare and our local community. So going back to slides, I guess it's 20 and 21. I'm trying to reconcile the ability to kind of fulfill the increased, I guess, supply. And it looks like for the School of Medicine, 55% admission rate, is that an accurate
That's correct.
number? So if you're doubling capacity, do you have the supply of potential students to meet that capacity, A? And B, how are you navigating, I mean, to be a doctor in New Mexico right now with the medical malpractice problems, GRT, there are a lot of constraints. It's really challenging. So how are you like navigating that environment to kind of help recruit, you know, I guess it's mostly in state, but anybody to become a practicing physician and, you know, stay here?
Mr. Chair and Member Trevisani, those are really two excellent questions. And so in terms of the supply, you will see that if we take our medical school class to 200, that looking at the number of applicants for medical school now, that it would indicate that we do not have enough individuals applying to medical school. I think that is part of the reason is that we have got to get the word out to New Mexico students that health professional careers, including a career in medicine, is something that is within their reach. I think the number of applicants that we have is much lower than what it should be. But I also appreciate that we've got to make sure that we don't lower the bar for individuals. What we really want is well-qualified, well-prepared applicants to come into our medical school class. So that is one of the reasons why I made mention of the careers, the communities to careers pathway, and the idea that we think about this starting earlier than the time that they would apply to medical school. So I believe that there's work to be done there. The last key point is that I believe that our commitment has to be to give a health professions education opportunity to every qualified New Mexican applicant that wants it. That is in fact our top priority. But the way that medical school application and admission is changing in the United States is that other states are creating opportunities, you know, for students too. Common practices would say that neighboring states are oftentimes given consideration for in-state. That's, for example, happening in Oklahoma. And so we will, in fact, I think, need to give consideration after we've given every New Mexican that's qualified the opportunity for a seat in a medical school class. Then who are those next groups that might have commitment, long-term commitment to New Mexico? And Member Trevisani, you asked also about what are we going to do to retain physicians? And I think about this in 4 buckets. We talked today about the training of physicians. But we also have to think about the retention and the attraction of physicians. And so creating the right work environment through our overall state policies is going to be really important so that we can help retain providers. But President Stokes also talked about the infrastructure issue, which is the fourth really big issue for us. Physicians and healthcare professionals actually need infrastructure to work in. And so part of what we have to be able to do is not just train the individuals, but build the infrastructure where they can work. That's why the story of building the healthcare delivery system and changing the clinical environment makes such a big difference to our ability to do this, because that's an opportunity for us now to recruit 350 more physicians. We can't do that till we build the infrastructure for them. That's actually true, I think, in other areas. It's not universally true across the state, because in some places we have infrastructure and no providers, but the infrastructure is a really key piece of it too.
Thank you. Appreciate it.
Or Sonny, you still have the floor.
One other quick one. And you talk a lot about the state, but UNM is pretty Albuquerque centric from a provider standpoint. I'm just curious about partnerships and, looking broader. You mentioned recruiting initiatives for like young students to come to UNM, but, are you doing things from, you are the only teaching hospital maybe in the state, or one of two?
So, Mr. Chair and Member Trevisani, so we're the state's only academic medical center, but we're not the state's only teaching hospital. We have supported building educational programs in other hospitals, and so helping them grow their own graduate medical education programs and supporting them, because we want to have as much educational opportunity. So many of the other hospitals and so, for example, in Farmington and Santa Fe and Las Cruces are also teaching hospitals because they have learners there. But we're the only academic medical center, and that means teaching hospital and clinical delivery system integrated. Your question was, what are we doing to, is this a statewide initiative? While the clinical delivery system component has historically been anchored in Albuquerque, the educational mission is statewide. Our job is to train the healthcare professional workforce for the entire state of New Mexico. I do believe, though, that there's still more opportunity for us to have a broader clinical footprint across the state. We do it through projects like ECHO and through telemedicine, but we've also recently started to do physical clinics. So we are building a clinic right now, and you heard this morning on your consent agenda, a clinic in Las Cruces. We have a clinic in Gallup. We are contemplating building our next clinic in Las Vegas. So this idea that we need to have a statewide network, both of physical plants and partners, I think is also essential to this.
Thank you very much, Dr. Fishburne.
If I may just briefly, and just so transparent, I talked to Dr. Richard earlier last week, I believe sometime. Didn't you also indicate to me that you're working with the private sector academia to collaborate rather than you used to be, you didn't want to collaborate with them, they didn't want to collaborate with you because whatever incentives everybody had. And is that part of what you're doing now?
So, Mr. Chair, yeah, that's exactly right. What we say, what we believe is that the role of the University of New Mexico is Health Sciences Center is to improve the health of New Mexico. And that's a very deliberate use of the word health and not healthcare. Because to improve health, the way that we do it, and President Stokes noted this, was through education, and that's training the healthcare workforce, both the workforce that's going to enter into college and then graduate with a new medical or healthcare professional degree and go to work. But it's not just that. It's also helping train the workforce that's in place across the state of New Mexico through education. The other really important piece is by the clinical delivery, which you brought up, Member Trevisani, and then through the research and innovation. What we have really worked hard to say is that the clinical landscape in which we work in cannot be viewed as a competitive landscape. If our job is to train the workforce to have the best possible Presbyterian, to have the best possible Lovelace, the best possible Christus St. Vincent, then we need to think of them as our healthcare partners. And that we need to build clinical delivery systems that work synergistically. And so we have worked very hard on doing that. And I think that you saw how that played out during COVID for our state, where our clinical delivery systems all came together and were able to work as one. And I think that that demonstrated that we were in fact making real progress on thinking about building the healthcare needs for New Mexico in a much more collaborative, synergistic way.
Member Travisani, you still have the floor. I didn't mean to interrupt, but
No, thank you for that. I'm good. Thank you, President Stokes, Dr. Richards, and Mr.
thank you, Member Travisani. Member Cassidy.
Thank you, Mr. Chair. Dr. Stokes, welcome. Dr. Richards, thank you for being here. This is so incredibly important. And I just want to recite and thank you for Dr. Stokes just reminding us the UNM Strategic Plan 2040 and the fact that UNM has embraced medical for the state of New Mexico, like you have education, faculty education issue. That's huge for, you know, the largest university research one institution in New Mexico to embrace that. A couple of years ago, I heard from both of you that a term that I hadn't heard before, which is the source of the problem, correct me if I'm wrong, that we are infrastructure challenged. And within that last 2 years, you've come forward, and we've seen at the State Board of Finance, all the clinical things that you've been doing, nursing, pharmacy, all of the other things that you brought forward. Psych, children and adult psych, the senior healthcare issues, all kinds of things are being put in place like no time in the history of the institution and the state. So I thank you for embracing that and allowing us to understand that. I appreciate the really thorough presentation. Obviously, we'll have to spend some time with this to really fully digest it. But one thing I wanted to just check on page 24. Thank you for already having financial summaries of what this operation can look like. And the conclusion that I've heard is that, yes, it can be self-sustaining. There's slight negatives here. But one thing I didn't see in here, which I think is really important to the discussion as this moves forward to the governor and to the legislature, that is, there's no debt service component in here. You're going to need grants, correct? State grants to make this happen, because debt service will only will challenge the financial viability of this. Correct me if I'm wrong. I'm going to say that, and if there's an answer now, that's fine. And then on page 33, I just wanted to point out that I really appreciate the fact that the conceptual view of the North Campus and how the healthcare system will be laid out, and it's all pretty contiguous and really seems very, very well thought out. And so I have no other comments except the number one issue in terms of recruiting physicians and for keeping the graduates from the medical school in New Mexico is the lack of a medical compact. Department of Defense has requested the state do this. The legislature's been trying to figure this out, but hopefully we can figure out a way for UNM and those of you that are trying to solve our healthcare issues as one of your number one priorities, to figure out how to get over the hump to get the legislature to adopt medical compacts, just like we need education compacts and a lot of other things to modernize our state. I'll just leave it there. I won't put you on the spot. If you want to answer any of those and respond, there's no need to today for my person.
Dr. Richards.
Yeah, well, Mr. Chair and Member Cassidy, let me address the capitalization of the construction portion of the project, because in the last legislative session, there was considerable discussion around what those potential options were. And there were two specific initiatives which were given consideration. One was Senate Bill 464, which was a modification of the tax bill that would have redirected the governmental gross receipts tax that's being paid by UNM hospitals to a capital project fund that would capitalize this. That bill also included an additional, component where the School of Medicine or the Health Sciences would make an additional $4 million a year contribution through the GGRT to that same fund where the GGRT would go. That, at least at the time when we were contemplating that would create about $39 million of funding that could then be used, and obligated towards long-term debt service for the project. So that bill was, given consideration. The second mechanism that was discussed, during the legislation was House Bill 449, which was the Higher Education Capital Projects Bill. Very different approach. This created the infrastructure for how to have a fund in the state of New Mexico to pay for very large projects like this. With, I believe, the intent that the capital resources that may have been committed to other projects or reserves could then be used to fund that higher education capital project bill. And so that bill, so both of those were mechanisms that were contemplated, but ultimately not passed into law over this last year. Immediately after the session, we then started with our conversations with the Legislative Finance Committee and Higher Education about reevaluating these options as potential ways to fund the project.
Thank you. Appreciate the response.
Thank you, Member Cassidy. Member Levon.
And Mr. Chair, just a couple quick questions. What is the retention rate of the people students that go through the program and go on to be doctors through this program?
So Mr. Chair and Member Lujan, so our current retention rate it varies depending upon how the person enters into the program. So for example, for individual, we didn't talk about residency program, but our residency program retention rate is right at the national average, which is just below 50%. But again, I think as we create more jobs, we'll be able to recruit more people to stay in the state. Our retention rate for individuals who go through medical school and residency goes above 50%. And our retention rate for individuals who go through like the BA/MD program are in the 60s. That's
Hello.
for medical education.
Okay.
For our individuals who go through health professions training program, like nursing and pharmacy, our retention rates are generally in the 90s. Now, for faculty that we recruit into the Health Sciences Center, this oftentimes comes up because I think that we don't really fully appreciate that we do in fact and can create a good environment for healthcare practitioners. Our faculty retention rate at the Health Sciences Center is 8.3%, as compared to a national attrition rate of about 13%, which puts us in a very high performing group in terms of academic medical centers and being able to retain faculty. So when I give you a big number like 300 or 350 more faculty, do I believe that we'll be able to recruit them? Yes, I believe that we will. We will still be challenged with recruiting nurses because everyone in the United States is challenged, but we will have, with these new facilities and the programs that we have, we will be a very attractive program in the United States. In fact, we already are. You know, we have about a little over 800 residents and fellows in our program. And every year we bring in about 180 new residents and fellows. We have over 13,000 applicants for 180 spots.
And do we have a current program designed to help even increase retention even more? It seems like the more we can keep, the less we'll actually have to be.
So Matt, Mr. Chair and Member Lujan, yes, we give lots of consideration to how we create a work environment and support our entire healthcare professional workforce to be able to retain them. And that is something that touches almost every aspect of employment, but we also think about that from a student perspective. And I'll give you an example of that. One of the things that we know is that when we give students experience in rural communities, that is an opportunity for them to see what rural healthcare practice could be like and to help them envision that that's something that they could do. So we work very hard to try and create educational opportunities for learners at all levels to be able to get exposed to rural communities. We also work hard to try and recruit from rural communities, because what we know is that those are individuals that are more likely to go back to those communities because they have the community ties and the family ties. And so, for example, our BA-MD program, 75% of those slots are reserved for applicants from rural communities.
Thank you. So I apologize, it was late to me and the governor had a longer meeting than expected. It was a good meeting though, which was a little longer than expected. So thank you, Senator Sessions, for starting the meeting for us. Member Lujan, do you still have the, would you still like?
No, I think you did.
Treasurer Matoya.
Good morning. Good morning, everyone. Good morning, doctors. Thank you for the presentation. I'm gonna try to put all my stuff in my head out correctly. So I heard about the 32 out of the 33 counties. Realistically, you put all of the facts out there of where we're at today. But what I also heard through your presentation was the possibility of optimism to be the leader in healthcare in New Mexico, to be the leader in using or utilizing our own people to uplift our own communities with the touch of rural being at the forefront as well. Is that your thought process as well in this, or what's the overall, if you had a vision of what you're gonna see after you're retired, what is it that you envision that you hope all of us today would be able to move forward?
So, Lieutenant Governor and member, I would say, Mike has spoken to this some, but I'll say in general, the answer, what you've portrayed would be the vision that in fact, as Dr. Richard mentioned, we want every single person in New Mexico who is qualified. And we want to create programs that help people recognize health professions, physician, workforce as opportunities for, for employment and professions. Our goal would be to populate our entire system with as many New Mexicans as we could possibly get ready to actually serve in these careers. And so that is a component of this entire project. We have some pathways, we need to do a whole lot more. I think that, our goal is in fact to be able to meet the healthcare workforce needs across the state. We feel like we have a major role to play in that, and some of that is related to partnerships with existing, healthcare and others. So, when I think about, I think you said something about retirement. I assume we're talking about mine. What I see is that we are building the infrastructure that does in fact allow New Mexicans to be at the forefront of solving the healthcare access issues for the entire state. Now, Mike will be able to answer that with more granularity.
Well, thank you, President Stokes. And so Lieutenant Governor and Madam Treasurer, I will say that what I am passionate about, and I know the President is also, and what I hope that we're able to convey to the faculty and the staff that work with us is that we are your university. We are your state healthcare delivery system. And so our commitment is first and foremost to the state. And that fundamental to that is that we all deeply hold and believe that there is nothing more powerful to change the economic status and the future of an individual than education. And there's nothing more powerful to change that family than education, or that community than education. And there's nothing more powerful than to combine those two things, education and healthcare. So our commitment is to try and give this opportunity, to New Mexican students, first and foremost, because we want to improve the health of the entire state of New Mexico.
Governor, so that leads me to my second question. I met with you all at the beginning of many of the executive orders and some of the ideas on Medicaid cuts and grant funding cuts, and I haven't heard that at all in this discussion. which I think is relevant because based on whatever happens with the big beautiful bill and with other executive orders, you're going to be impacted financially on other aspects. So for those that are not aware, we're number one Medicaid recipient. Almost 80,000 of our babies are born into Medicaid. Our grants and our research funding has been impacted just like the rest of the country. And we're looking at how do we compensate short term, but then also long term. So can you give us a perspective on where you're at with whatever potential funding cuts you might have already received or looking at, and how that impacts what you're requesting for the future?
So Lieutenant Governor and Treasurer Montoya, I think you're exactly right. On the idea that we've got two sets of problems to work with at the exact same moment. First, let's acknowledge that Medicaid and the state support of the university, largely through the Medicaid program, is why we've been able to build this clinical delivery system. It is how we've been able to grow our graduate medical education program. And we are profoundly grateful for that partnership with the state, because that is what's given us this opportunity. The next key point is that we will, in fact, we have a lot of uncertainty right now with the changing of federal priorities and the changing of federal resources that will come to New Mexico. We are doing contingency planning on how we would address Medicaid reductions. We have a total of 10 different Medicaid programs funded through 5 different Medicaid payers. So a Medicaid reduction isn't just a one thing. So understanding exactly what those reductions are going to be, we will then understand a little bit more about what the implications are. We recognize that the funding mechanisms and the partnerships that we've done with the state through our enhanced Medicaid payments, we cover those through our intergovernmental transfers. And so we right now get our enhanced Medicaid payments through supporting that through about $179 million of intergovernmental transfer. Will there be potential implications to this? The answer is very, very likely. But until we get the detail about what that means, I can only say that we're doing the contingency plan. We've already started to see some reduction of some of our research and grants. And we've started to pivot around those. Unfortunately, much of that is hit our training and education programs, because we were highlighting, our commitment to diversity and equity and inclusion. But what I can say is that many of those programs were in place, supporting the learners of New Mexico, before we were asked to highlight that they were diversity and equity and inclusion like programs. And so when we relabel them to what they were before, we will still be committed to the same learner population, because at the core of who we are and what we do, it's not that label, it's what we do for the state of New Mexico. So we're working on that. So I do believe that we may have some significant challenges, which we will adjust to. But then you also, Treasurer Montoya, point out the other really important piece of this, which is while we are making the short-term changes, which may mean some reductions in services if resources do get decreased, we still have to think about the healthcare infrastructure for the state of New Mexico for the next 5 decades. And so we can't let whatever the short-term challenges are completely stop us from building the infrastructure we need, because the reality of it is we don't have enough of it now, and we cannot cut ourselves to sustainability or good health in New Mexico. We still have to grow ourselves into the healthcare that the state needs.
And last question, Governor, is on page 27, you talk about the return on investment in fiscal year 34, $2.54 projected to be returned in state and local revenue. Are you including property tax, or is that, what type of tax revenue are you referring to?
So, Lieutenant Governor and Treasurer Montoya, this economic impact was done by a third party for us called Tripp Umbach. And my understanding is in their methodology, they included all potential tax revenue sources.
So, Mr. Chairman, I would also argue that based on Echo Northwest research that we just had, the increase in outmigration is something that is impacting all of us. outside of just people graduating and then moving on. It's in total in New Mexico. The increase in poverty is one of the highest in the nation. The increase in crime is the highest in the nation. So when they factor in people becoming educated, participating in the workforce, I think that the dollar investment and the value is a lot higher than $2.54 for every dollar we've invested. I think that the investment in that to decrease crime, to increase people staying in New Mexico, to increase value in housing so that you have property taxes, which then helps takes care of your roads and your schools and your hospitals, is a larger investment than the $2.54. And the idea of us not doing it, how that non-investment works for us in putting more money towards jails and more health issues instead of being healthy is another aspect to take a look at. So for me, I think my takeaway, it's a little daunting, but if I can envision and be hopeful for the future to see that we can be the people that can actually have doctors that can be seen within a month instead of 3 or 6 months, or people come here instead of our people having to go to other states to get care, to be able to have a healthier community. Right now, New Mexico is #1 stressed in the country. I think all of that factors into a different peace of mind that would help all of our state. So thank you. Thank you, Governor.
Thank you, Madam Treasurer.
Governor, welcome, and thank you again. One more follow-up question, but I want to say thank you again for embracing us and helping us solve these problems, and you've done it in an amazing short period of time. This board, we're around for another 1.5 years or so. Will we see an application for this project before the end of 26, or what is the actual time schedule?
Governor and Member Cassidy, I think that is completely dependent upon what happens in this upcoming session in terms of the funding mechanism for the project.
I would encourage all of us to see if we can't get there before the end of 2026 and get it through. Thank you.
Thank you. Member Cassidy, the Senator's Andrews, just briefly.
President Stokes and Dr. Richards, thank you for the presentation. It was very thorough. And having visited with you before, you've answered a lot of the questions that I have. You know that I still feel we don't have enough service providers in our rural communities. And I always bring up Valencia County because of our need there. But it's just not there yet. I don't know if I'm gonna be around in 2035. Who knows if any of us are gonna be around in 2035. But it's really encouraging to see that you're planning ahead for the future and working on retention. And one of the things that kind of confuses me a little bit, and we talked about it, Dr. Richards, is how do we get into the high school to make students want to go into the healthcare profession? And I'm not sure we're there yet. It's kind of like when the lottery scholarship was out there and none of the kids really knew about it and no counselors were talking about it. And they had to find out, or they didn't find out in time to do it way back when that happened. So I think we need to go into our educational system, our high school, maybe even junior high, to start talking about how beneficial it would be for our students to want to get into the healthcare profession, to want to be PAs, to want to be nurses, to give them the encouragement that sometimes they need coming from the areas that they come from and the lack of information that they may not be getting. So I think it's very important that something happens in that regard as well. One of the things that you said, Dr. Richards, is we want well-qualified and well-prepared individuals to go into healthcare. What does that really mean? Because I have seen people who may not really do well academically end up being very prominent, very educated, and providing services that maybe some of those who are more educated have not been able to do. So again, I'm not saying you lower your standards, But I'm saying you have to take into consideration some of the factors of where the people come from, the situation that they lived in, the educational system that they've had to, not gonna say endure, but have to be in. And you've had a lot of students at UNM who may not have been the greatest in high school, but turn out to be really fabulous students when they get to college. So I'm hoping that's not what we're talking about. Again, not lowering our standards, but understanding our state and where people have come from and encouraging them to want to be the best that they can be. And that healthcare is really something that's important, not only for their parents, grandparents, but future generations as well. So maybe you could expound just a little bit, and I don't mean to go into it too long, but something important to me because, again, I've just seen people who don't do well at high school or what I still call junior high that have turned out to be just fabulous students later on. And maybe because of, maybe they don't make the greatest grades and how we grade students now, but maybe they could be also put into.
Well, Governor and Member Sanchez, we completely agree with you about the need to make sure that individuals know about these opportunities and that we try and build as many pathways as we can for them to understand that these are career options for them, but also to understand what they need to do to be prepared. But we also understand that there are other specific things that we can do. So here are a few examples. One is that we set a threshold for entry into the health professions programs that demonstrate that individuals have the capacity to be able to do the work. And then from there, we do holistic interviewing. So we don't just take the person that has the top score. We take a diverse group of individuals that demonstrate the capacity that lets us ensure that we're not eliminating someone who could be successful in these programs. Number two is that I believe that we need to be prepared to provide additional support for our learners once they're in the educational programs. Because many of these students may have the complete aptitude to be able to do this work. They just have not been given the ability, to fully develop that aptitude. So building more robust student support services around test taking and around learning is another important portion of how we can ensure that they are successful. A third element of this, and this is a bit like our BA to MD program, is to create pre-entry educational options. So where you can start early, helping them develop the skills and aptitudes so that by the time they arrive at health professions education, they are more prepared. Or one thing that Dean Fenn, our Dean of our School of Medicine, is contemplating is, do we offer up a graduate level transition program for individuals who may not quite be there, but could get there if we gave them some more educational opportunity? I don't think that there's one solution, but know that we share that concern and that we are committed to building a portfolio of options that lets our students be successful.
Thank you. And lastly, I agree with Member Caskey that it's imperative that this next legislative session, that one of those funding bills gets through no matter what. It absolutely has to, or that dream might not ever happen. And I mean that. And I would hope that the legislature understands the importance of it and any political fighting between legislative and administration should go away and come together to make sure this thing happens as soon as possible. So thank you, Governor.
Thank you, Senator. Just listening to you, Senator, brought me a lot of inspiration and reminders of the vision you had so long ago, and every student having an opportunity to attain a higher education, where a lot of times students were told that you may not be college material. With your leadership, we have a fully funded lottery scholarship and opportunity scholarship. And so that just brought me good reminders of the work that you guys, so thank you for that. I did have a couple of questions, and I think this is very impressive, the information that you put together, so thank you for that. I did want to just on the B and B program, when I just come in, you had mentioned that 75% of those slots are reserved for rural students. How do we define rural as opposed to frontier communities, and do we have any data to be able to show the difference there?
So, Governor, it is, it's the, I believe that what we mean, and I'm sorry that I don't have the exact definition, but it's non-Bernalillo, non-Santa Fe, county, non-Bernalillo, non-Sandoval, non-Santa Fe. So it's all other counties with the exception of those.
So those 75% outside of, it doesn't include Las Cruces either?
I believe that we consider Las Cruces to be in the 75%.
Okay, yeah, just interesting to see on that, on the breakdown, because I think that's important when we talk about, and I wasn't asking for a specific definition of from frontier and rural communities, but there is a difference though, because I'd like to know, like a student from Reserve, New Mexico, not different than a student that may be coming in from Las Cruces or Hobbs or Slogan. And so that's where I was trying to get a little bit more deeper into the data there to see where our students are coming from. And why that's important to me is we know that the mission of getting our students prepared, getting them out to the field is, we know that the residency programs, more than likely, if they grew up in that community, they have a chance to be able to do some of the residency programs or go there, that they're going to return to that community, which we so desperately need. So that's why I was trying to dive in a little bit deeper on that. And maybe what we can do is get the population breakdown of the two, and then just to be able to expand and build on that. Thank you.
Absolutely, Governor, we'll get that information for you. The key intent of that is that we know that we want something that's not just the Albuquerque metropolitan area.
Thank you for explaining that. President Stokes, is there any other information you want to present?
We're just delighted to be here and share this very exciting project.
Thank you. Any further questions from board members? Any further additional information from staff?
No, thank you.
Thank you for joining us again, and thanks for putting so much time into this presentation today. Thank you.
Thank you.
We'll go on to item number 17, and that's going to be presentation on the annual debt affordability study. Liz, are you doing that? Lisa, are you doing that one?
David Pauling.
Okay. Ah, there you are.
I am.
Welcome. Thanks for joining us.
Thank you very much, Governor, members of the board. My name is David Paul, the Fiscal Strategies Group. We're the financial advisory to the State Board of Finance. And it's wonderful, I have to tell you, to see people in person at this meeting. It feels like it's been a long time since I've been in face-to-face meeting with such a full quorum.
You look much younger today than you do on.
You know, I was not going to bring up anything about it. But since you referenced, I hope that we're all around in 2035, right? I know that you meant that your political position. As we get older, we become more skeptical. I do want to say, just as a side note, we just received competitive bids this morning for the severance tax bonds. And I'm just passing this along as a information item. The sale went extremely well. The winning bid was a 361, which was about 5 basis points higher than the general obligation bonds that were sold 2 weeks ago. We'll get into, they're quite different credits. And I think that the strength of the severance tax bond being that tight to the GO was a great testament to the conditions, both of the state of New Mexico in general and what's going on in the state in terms of natural resource production. And that's going to become a central theme of one of the things that I want to talk about. Just by way of introduction, And please interrupt at any point with questions or comments along the way. The debt affordability study process began quite some time ago, certainly a decade or more ago, as an opportunity for the DFA and Board of Finance staff to take a deep dive into the debt programs and what the credit factors are that are salient to the work of this board, of the cabinet, of the legislature in advancing the work on behalf of the people and the taxpayers of New Mexico. This process, as I reflected on it as we were putting this study together, has been, it might belie some of the casual assumptions people make about, the fractiousness of the legislative process and how the executive and legislature work together in New Mexico and in states in general. But I think in many respects, it's been a testament to how well people work together in this state, because over the years, as I reflected back, these studies have raised a number of core issues affecting the state credit and how the bond markets view the state that have been fairly in good order, integrated into the legislative process and into the legislative agenda of sequential chief executives, and have been quite notable in terms of highlighting issues around pension funding that then became parts of significant legislative and gubernatorial effort to improve the quality of the state pension systems. In particular, changing the entire perspective on how the ERB, the teacher pension, educational retirement pensions were viewed, which used to be, there was a strong desire to view those as things that belonged on the balance sheet of existing school districts. But after those issues were raised and fleshed out, people came to really grasp the nettle there, which was that these are ultimately state-funded obligations, and state initiative was required to successfully address those. More recently, other issues have come up in terms of the rapid growth in debt capacity on the severance tax bonding side. And the legislature recently agreed effectively to limit the amount of debt issuance so that the debt ratios of the state would be moderated over time. And there are other issues I could point to, the setting aside of money for capital planning, particularly for smaller communities. These are all things that have been integral to the thought process around this table, the way that those questions have been raised in this study, the way this study has been then brought into the legislative process. And I think it speaks well to the nature of the political process in New Mexico. And I just felt it was important to begin this discussion just by putting this into that context. The study, as a general matter, begins with a review of the state bond ratings and the reserves and the pensions, and how the state bonds are viewed in the credit markets, and what salient issues should come through that review process, as the rating agencies essentially serve as intermediaries to convey questions and provide, as we'll discuss in a minute, kind of applause in a sense for the work of the folks around this table and within the legislative and executive branches of the legislature. We then review the State Board of Finance, in particular bonding programs, and what things look like going forward. And we come back with a conclusion around the affordability of state debt programs. Just going to the next page on the state bond rating overview. The state bonds are both rated right in the middle of the AA category by S&P and Moody's. The ratings reflect primarily or anchored in the strong reserve balances that have been, and this is a change in the profile of the state versus a number of years ago. And it's also a change in how reserves are viewed. In particular, and I know this is going back a few years, but to the global financial collapse. It used to be back in the years gone by when Paul Cassidy was a cornerstone of the investment banking industry in New Mexico, that it was fine for a reserve balance to be around 5%. That was viewed as a strong level of reserve. And what we learned in 2005, in 2008, is that in the face of a significant downturn, 5% really did little or nothing to provide significant protection, because the volatility of the world was much deeper than people, was much more significant than people thought. In accordance, the state, through a number of administrations, and notably this administration, has really stated their commitment through their actions over time to build up substantial reserves. And those reserves have been the cornerstone of maintaining the strong bond ratings. I think the probably most important thing to note on this side is that Moody's has a positive outlook on the state general obligation bond rating. And they've indicated that in their terms, they will resolve that positive outlook in the October or September timeframe. And by resolve, meaning they will either upgrade the state rating or return the rating to stable. That what they've indicated to those of us around the table who've worked with them is that they would expect that to be an upgrade to AA1 from AA2 on the general obligation bond rating, unless something were to happen to kind of deter things. That seems to me to be less likely something at the state, because it's not a whole lot that goes on in New Mexico that affects that outlook between June and September. I think would be more significant if there were a significant downturn in the national economy, if the concerns of the recession are borne out. I'm going on to the next page. This simply illustrates the magnitude of the buildup in operating reserve over the past decade. As you can see in the chart on the lower left, the lower red line marked the 5% level. And the 5% was significant because the last time the state had a significant downturn in its ratings was when the state was projecting a 5% reserve and it fell to 1%. And if you look at that in the context of where the reserves are now, that just tells you how far things have come, both in terms of how reserves are viewed and how the state has responded to the reserve expectations. One of the things that has been a significant portion, moving on to the next slide, of how the ratings are viewed has been, as I mentioned up front, the level of pension funding. And what you see in the graphic on the right, and New Mexico well down towards the bottom of the chart, is a level of indebtedness and pension underfunding in aggregate, and how New Mexico compares to national medians, where it's now under the national median, where if you look a few years ago, it was a much more significant issue for the state. One of the changes that's come about over the course of these studies being done is really making much more concrete in the eyes of rating analysts that there is no material distinction between debt and pension underfunding. They both reflect long-term obligations of the public sector. It used to be that the pension underfunding was kind of a side note, a balance sheet item when people looked at the indebtedness of the state. And what you see now in this graphic is that these are really now viewed in tandem. On the left is the lower left is the more traditional analysis of debt as a per capita and debt as a percentage of personal income within a state. And you can see what both of those lines indicate is that against both of those measures, the state numbers are moderate and reasonable. This has been the focus of this work for a number of years, over the past several years, as the state bonding ratios, as severance tax bonding began to increase with the impact of fracking in the state, that these numbers were beginning to get a bit out of control. And you can see the projected numbers became quite significant. And the response to that has been, as I suggested up front, a very reasonable grasping of that issue within the executive and legislative process. And we've seen the state of Grace, particularly, I think it's House Bill 253, the kind of acceptance of the fact that more moderate levels of bonding are prudent. And prudent, I might say, from the standpoint of simply capital allocation. In both the private sector and the public sector, the allocation of capital is a core duty of CEOs in the private sector and the combined work of legislatures and executives in the public sector. And in New Mexico, the visions of that much capital to spend may be alluring, but the ability to spend it is much more difficult. And we've seen that for years in the state, even when the bonding levels were lower. And I think, we've seen that this year with the Public School Capital Outlay Council, realizing that it just can't spend the amount of money that's available. And that's been that's money that's available essentially on a cash basis. And that also, I think, reflects a degree of maturity within the state process in general, of people recognizing what the reasonable limits are. On the next page, we have a graphic that simply illustrates the primary sources of state funding for capital projects. Primarily the general obligation and severance tax bonding program. What's significant about this, and is reiterated in the report, it has been for years, is that the cash funding through the what has become called the sponge bond program has become a significant share of capital investment in the state. And the state is quite fortunate. It means that you are able to fund critical capital needs on a cash basis, and put less of that funding essentially having to be paid back over time. The next slide shows the general obligation bonding program. And this is one that really became quite interesting as we started to look at it, in some depth, both last year and this year as we went through this study. And what you'll see there, the beginning several administrations ago, the executive chose to place a constant mill levy cap on the amount of general obligation bonds that were put on the ballot for public consideration and voted referendum. And so the debt capacity for general obligation bonds has been based on a flat mill levy for getting on a couple decades. Yet what you see here as you project forward again in a flat mill levy is this upward slope in the aggregate interest costs. And what you'll see, the aggregate debt service costs, for a bonding program that continues to have a very short life of 10 years, which means an average life of these bonds of 6 years. And what you'll see on the next page is two factors that really led to this. One on the lower left, as it illustrates that we are now coming out of, or have come out of in the post-COVID period, the 10 to 15 years of zero interest rate policies following the global financial collapse. It's hard to overstate the impact that the 2008 collapse had on a number of aspects of our society. It had it on interest rates, it had it on a wealth accumulation at the highest end. When you have zero interest rates in the denominator of the calculation of any asset, the value of that asset goes up significantly. And what you see in the lower left here is something that shows simply the increase in the cost of the debt that becomes factored into that debt service schedule that showed there once the interest rates become real interest rates. And it's interesting because 3.6%, which was the interest rate on our last GO bond, that's not a high number. But we've had numbers over recent years that were below 1. And so, on a multiple basis, one number is 3.5 times what it was a few years ago to issue bonds. But the point I want to also focus on here is the table on the far right. And this was referenced in the debt affordability study, but it's really something that, I'm really kind of bringing to your attention, verbally in some respects, because it's kind of something that we really began to just focus on, which is if you look at the growth in real property subject to the real estate tax and the supporting general obligation bonds, the growth in fracking has had as material an impact on the general obligation bonding program as it's had on the severance tax bonding program. It's not necessarily intuitive, but if you look back at what the growth in property subject to the real estate, to the real property tax, real property taxation supporting the general obligation bonds, the assessed value of residential property over the past 10 years has been less than 50%. So, somewhere around a little bit, maybe 4% a year compounded. The growth in assessed value of the oil and gas industry property subject to that tax has grown by over 500%. And what that translates into is what the graph on the lower right shows, which is that a significantly increasing share of the repayment of general obligation bonds that are voted by the public are actually not repaid by the residential and non-residential real estate in the state, but by the taxation on oil and gas industry assets. From a certain standpoint, that's a great thing, because you have the ability to finance higher education, to finance senior citizen facilities, and the other things that are generally put on put up for voter referendum, do a taxation on an industry that's doing quite well. The cautionary word that I would suggest is that it's been some time since we've had the cyclicality of the oil and gas industry. It used to be quite common in the West. I live in Denver. Denver was a city, and Colorado was a state that was very much of a boom and bust state based upon what was going on in the oil and gas sector and natural resource extraction. The thing that occurred to me as I looked at this is, once you issue bonds with an obligation to raise taxes as necessary to pay those back, are there risks, and I don't know the answer to this, are there risks being taken that if we go through another cycle, that we will be forced to raise taxes on the residential sector in the event that there is a significant write-down of the valuations in the oil and gas sector? Simply raising it as a question, because as I looked at this, it seemed to me that that's something that actually state economists should be, giving some thought to. On the severance tax bonding fund, if you look back 5 to 10 years at these studies and look at that graphic at the bottom, you would see a very different picture, one where the yellow line of future debt service grew to basically absorb 50% of the revenues over a 10-year period. Now, with the more moderate approach to financing, what we're seeing is that the debt service in the severance tax bonding fund is a much smaller share of those revenues and is projected to be going forward. The green revenue, essentially the green number under this graph, is showing what the cash financing is that's available through the SpongeBob program. And if you look over to the left, that's where revenues used to be on a normal basis. And you can see that the yellow line probably gets close to 50% of what used to be the normalized revenue. And that kind of indicates the shift in this overall funding program. The next page shows the aggregate projected funding available through the general obligation and severance tax bonding program. As I mentioned earlier, a significant portion of the capital that you'll have available to allocate is now going to be on a cash basis. What's also illustrated there is the winding down of the transportation bonding program, that if you go back,
I also have a bag fee. I've
don't know what I did with the one on the way back. I think that's the one for on the way there.
I was hoping that was a
So.
question.
Oh, well. Okay, thank you. You know, Southwest is already starting charging for bags.
Madam
Dude, that
Secretary,
Delta experience was great.
Do have to pay
Yeah.
for that now in Southwest.
Assigned at 35. They're gonna start doing assigned seating, just like.
Yeah. Go ahead. Okay. I'm still struggling with the United versus Southwest dichotomy. I have to say though, and I would note this, the service of the Santa Fe is much better than it has been in the past and much less expensive. It really offsets the value. Just to try to get towards the punchline here, there is a punchline in the debt study. If you go on to the next page, what it simply illustrates is the moderation of the debt ratios over time. You know, it's, I talked about it previously. You know, one of the things that's interesting about when this study, when it first started being done, is the nature of your bonding programs is that they're inherently affordable. And what I mean by that is that the affordability issue is generally viewed as a question of how much does the debt impact the general fund? If you look at general obligation bond credits on the eastern side of the country, they tend to be paid for, they're still voted or they're subject to a mill levy limit. But the debt service comes out of the general fund. And it was a major issue in the Detroit bankruptcy. And one of the things that we learned in the Detroit bankruptcy is that while general obligation bonds are generally viewed as the highest and best credit of a local community, because you had this unlimited obligation to tax, to pay them. In Detroit, what we learned is that they really were the worst credit. They were a subordinated debenture in corporate finance terms that were paid for by the bottom bucket and really suffered the most in a bankruptcy setting because the tax levy that you had to levy at an unlimited basis, first of all, it went into the general fund. And second of all, in a city like Detroit, and there might simply be limits to how much you would produce if you kept raising the level. In New Mexico, both the severance tax bonds and the general obligation bonds are paid for by completely distinct revenue streams that have no claim on general fund resources. Therefore, from an affordability study, they are inherently affordable. So part of it seemed to be, was this study just didactic in a sense? You know, of course it's affordable because you're voting the mill levy and that's what pays for it. But I think what's been salient in this process is that it has become a way for policymakers in the state to look at, you know, take a deeper look at the factors, at broader factors affecting public policy of the state. And I think it's been a useful process from that standpoint. And we've laid out, you know, the kind of some of the salient issues that have been raised that I discussed at the outside. But I'd love to answer any questions you might have since nobody was willing to interrupt me except for bag fees.
Great. Thank you for the presentation. Any questions from board members? Treasurer Matoya.
I did want to interrupt you, but I thought I better not. So, I want to get clarification. Our bond rating has not decreased at all, correct? When you were talking about bond ratings potentially going down or being back to.
No, Judge Montoya, no, I did not. I mean, there have been times when it went up and down in the past. The rating agencies, particularly since 2008, have struggled with their criteria and how to rate bonds. There has not been any recent downward.
I just wanted to make sure everybody got that. And then, on the other aspect, I wanted to talk a little bit about, the pension fund. If we could go back to that slide. The line in the middle, that is the median, what number is that? Because I know we're about at 60% more or less. And so I was curious, just because I knew a lot of other states had that same liability close to where we were at. And hadn't seen any effects one way or the other. I do know that, the rating agencies decreased, local governments because of their pension liability. But I met with them and they said that states would not be considered or factored into any of that in the future. But I was just curious, I didn't know what the dotted line was.
But that reflects the median, cost of what is shown here is that what they call the net tax supported revenue, which is in your case, transportation bonds, severance tax bonds, general obligation bonds as the primary one, plus your annual net pension liability, plus your unfunded liability. So it's looking basically at your aggregate liability burden, including pension liabilities and debt,
So,
as a percentage of own source revenues, which is your non-federal revenues, basically your general fund.
and so Governor, the different colors that are there, are they in the order of what's on the top?
Yes.
Okay,
Yes.
and the gap that's there, what amount is that?
Well, it's not a gap, it's just where are you relative to the median? And if you like, I can send you a copy of the report that this is built on.
I'm referring to this gap
Yes.
right here.
That's just how much are you below the median? How much better are you than the median?
And then the last question I had, Governor, is, on the real estate.
Yes.
Because a bill just passed, well, there was a constitutional amendment that got passed on the veterans exemption.
Right.
They tried to resolve it or make it not as bad. But I had seen the analysis when I was a county treasurer, how negatively it will impact rural communities, because that's where a lot of our veterans are located, plus the senior value freeze, because most of our rural communities have a lot more seniors in them as well. And that had all been factored into the potential of what's gonna arise from the property taxes that we receive, because it already showed property taxes really aren't what's paying for the debt that voters are voting for. It's oil and gas, and we know that oil and gas is.
Oil and gas property.
Oil and gas property, I'm sorry.
Yeah.
Perfect. Because that is also needing to be factored in, is that something that was considered in the numbers for the future? Is that something we still need to add in there?
The numbers for the future are based on 10-year projections that by the economists of the state. So I presume that they would be factoring that in.
Okay, thank you, thank you.
Thank you, Madam Treasurer. Any further questions?
Governor, just a comment. David Paul has represented the state for how many decades now?
3 years, Paul.
Right. Save the gray hair, but this report, it's been around just a decade, it seems longer, but this is just terrific. And it really paints a fabulous picture for the state. Not only for operational reserves, but for the debt side of the balance sheet. It's really unique, and there's never been anything like this in New Mexico's history. And just thank you for doing this. And I also want to commend our staff and Secretary Props for a lot of great leadership working with our advisor here sitting in the room. You know, to put in the policies that we've been able to put in the last 4, 5, 6 years that really positively impact this financial picture, and deservedly so. A rating upgrade hopefully will come this year to really cement in the fact that it's recognized in the financial issuers compared to the state of Mexico. So thank you.
Thank you.
Thank you, Governor. Thank you.
Any further questions? So no further questions. Thank you for the presentation. Appreciate all the service that you provide for us. Thank you.
Thank you very much.
Have a good day.
Great meeting.
All right, we're going on to bonding program. That's going to be item number 18 on your agenda today. Please, thank you again for joining us.
Yes, thank you, Lieutenant Governor, members of the board. Good morning. As you know, Louis Carrasco with the Brody Law Firm. You're serving as your bond counsel. And you'll recall in the last few months, we brought to you several resolutions authorizing general obligation bonds, severance tax bonds, and severance tax notes. And I promise to be back before you to make changes to the project list that are authorized by each of those resolutions. And that's in essence what we're doing with these resolutions here today. So on, as agenda item 19, you have your amending resolution for the state of New Mexico severance tax bonds, series 2025A. You authorized an amount up to 292 million. Those bonds, as Mr. Paul was just mentioned, were sold this morning. And so what we're doing with this resolution is adding the projects that have, the list of projects that have been deemed to be ready to receive tax exempt funding for the legislatively appropriated projects. That determination came following the completion of the due diligence process by board staff, bond, tax, and bond counsel, whereby each project was evaluated for compliance with legislative authorization, conformity with the rules governing the use of tax exempt bond proceeds, and adherence to other constitutional, statutory, administrative, and regulatory requirements. These bonds are one of a series of long-term bonds, and you'll note that these the maturity on these is 10 years. So we will pay these off in 2035. Historically issued by the Board of Finance to fund legislatively appropriated capital outlay projects. Interest on these bonds is excludable from income for federal tax purposes, and the final amount of the bonds, as was set this morning, is $235,100,000. And on top of that, an original issue premium of $17,420,587.15. And those proceeds will be used to fund 19 unique capital outlay projects totaling $252 million from legislative appropriations to 9 different state agencies or other governmental entities, as further described in the attachments to the resolution. The final amount of these bonds is less than the maximum amount authorized by the board of $292 million. And the amounts in the severance tax bonding fund are pledged to the repayment of the debt on these bonds, along with other severance tax bonds. These bonds will be issued on June 26th and will mature on July 1st, 2026, and each July 1st thereafter until July 1st, 2035. And will be sold to the original purchaser who was identified this morning that's Barclays Capital Incorporated. And they were the bidder that offered the lowest true interest cost for these bonds. And as Mr. Paul mentioned, that rate was 3.61013. The legislatively appropriated project designated for funding with severance tax bond proceeds that were not deemed ready to be funded with these proceeds will be again considered for funding in December 2025 and or June 2026. And I would just call your attention to the exhibits to the resolution that has the full list of projects that we're discussing and what you would be authorizing the use of bond proceeds to fund if you adopt this resolution. And with that, I'm happy to answer any questions on this resolution.
Thank you. Any questions from board members? No questions, any additional information from staff?
Mr. Chair, thank you.
Okay, thank you. Question, this is an action item.
It is, Mr. Chair.
I can entertain a motion.
Mr. Chairman, I've read it at least 7 times. Motion to approve.
Motion to approve. We have a second.
Second.
A second. Any more discussion? We don't have to do a roll call today.
Yay.
That's the first time since- Yeah. All those in favor, signify by saying aye.
Aye.
Any opposed? The ayes have it, motion passes. The ones item, that kind of took a little while because I wasn't used to a motion like that. Let's go to item number 19.
I thought that was 19. I'm sorry, 20.
Okay, 120, yeah.
All right. You have before you, agenda item number 20, which is the amending resolution for the state of New Mexico severance tax note, series 2025 SA, in the maximum principal amount of $620 million. As with the last resolution, the main purpose of this resolution is to finalize the list of projects to be funded with the proceeds of the SA1 note following completion of our due diligence process by State Board of Finance staff, bond tax, and board counsel, which is basically identical to the process that we followed for the projects to be funded with the severance tax bonds you just approved. You'll recall, this is similar to what we did last year where we bifurcated the senior note into the SA1 note, which will be used to fund legislatively appropriated projects, and the SA2 note, which will fund the deposit to the capital projects reserve fund that was part of the 2024 legislation to set up that fund to allow for planning and design and smaller capital outlay projects throughout the state. So the Series S 2025 SA1 note is one of the series of short-term bonds customarily issued by the board to fund legislatively appropriated projects. And unlike the 2025 A bonds, interest on this note is not excludable from income for federal tax purposes, and we anticipate that the final amount of the note will be $512,580,689. And that amount includes $169 million for appropriations to the Department of Transportation and Indian Affairs Department to fund 6 individual road projects around the state, which were authorized by the 2024 legislature. Plus $137,668,980 to the Water Trust Board for various water projects and associated adjudications, $80,574,147 to the Tribal Infrastructure Board to fund capital projects in various tribal communities, and $80,574,147 to the Colonias Infrastructure Board to fund various capital projects within Colonias near the US-Mexico border. And finally, $44,763,415 to fund the New Mexico Housing Trust Fund, as has been done in recent years. The resolution also memorializes the anticipated deposit to the Capital Development Reserve Fund as directed by 72752A of the New Mexico statutes. This deposit will be funded with the proceeds of the A2 note, as I mentioned, similarly as it was done for last year. We currently expect this deposit will equal $81,600,000, which was the maximum amount authorized by the board. Together, the A1 and the A2 notes total $594,180,689, which is less than the maximum amount authorized by the board of $620 million. These notes will be issued on June 26th and mature 1 day later on June 27th, and will be privately sold to the state treasurer pursuant to note purchase agreements at an interest rate consisting of the secured overnight financing rate plus 15 basis points. That rate was set yesterday, June 16th, and with the additional 15 basis points totals 4.3137%. As required by statute, upon the repayment of these notes and the supplemental severance tax note, Series 2025B, the monies remaining in the severance tax bonding fund, less the amount needed to make the next 2 debt service payments on all outstanding severance tax bonds, will be transferred to the severance tax permanent fund on June 30, 2025. And in addition to what I just presented, there was a change made to the Exhibit A yesterday that I wanted to call your attention to. The only change there was we reduced the amount compared to the version that's in your electronic agenda. We dropped the amount for water projects, which is the second column there on Exhibit A, down to $137,668,900 for the water projects. That funds most of their need, but we are planning to fund the rest of that allocation with proceeds from the notes that are going to be issued in December. And so that brought down the total for the projects to be funded by the A1 note to $512,580,689. So I just wanted to make sure you were aware of that last minute change. And with that, I'm happy to answer any questions the board may have.
Thank you for that. Is there any questions from board members? See no questions, additional information from staff?
Yes.
None, I'll go ahead and entertain a motion.
So moved.
Second motion to approve, we have a second, by that member Lehart. And we have a second. All those in favor signify by saying aye.
Aye.
Those opposed, nay. The ayes have it. Luis, thank you. I think you got the next two as well, right?
Next thing, yeah.
Go on to item number 21.
Lieutenant Governor, members of the board, thank you. Similar to what we've done for the severance tax bonds in the last two resolutions, but this one is for your capital projects general obligation bond series 2025, which priced on June 4th and are set to be issued this Friday, June 20th. You may recall back in April, when you adopted the authorizing and delegating resolution. That resolution contained the entire list of projects that had been included in the 2024 General Obligation Bond Act, as we anticipated that we would probably, as it hadn't been done in years past, be funding all of those projects. However, since that time, and as a result of our due diligence process, we learned that a significant portion of those projects either were not ready to expend the bond proceeds, or given the option of the ability to be included in a future bond sale, that they would prefer to wait to do that. So we followed our due diligence process. We winnowed out those ones who, for various reasons, were not ready to receive tax exempt bond proceeds for their projects or wanted to wait. It was the decision, I believe, of the director that we would plan on issuing another bond issue in December to capture any of those projects that have now become ready or needed the money at that point. So what we've done with this resolution is we're substituting out that a full list of projects and substituting it with this amended Exhibit A that excludes the projects that were not ready to proceed at this time. So we're just making sure to memorialize which projects are appropriate to receive funding from these bond proceeds and to make sure that they do get the appropriate funding. It's very similar to the amending resolutions that I presented earlier today, but I'm happy to answer any questions the board may have.
Any questions, member, treasurer and clerk?
I do have a comment just for the board. I know we're flying through these ones today because all the work has been done, but there's so much work in these. It is so convoluted, confusing, stressful, end of month, end of fiscal year. It takes a full team effort. So I'm very grateful that the director didn't allow for things to go in there that are not ready to go in there and not just spend money to say, spend money. I've been very thoughtful about that process. We have an arbitrage issue that we've all talked about, and we're having to deal with that right now because people have not spent the money that they've requested, that they've had allocated, and it just hasn't gotten done. And we're now, because we did such a great job during the, with rates, we made a lot more money than what we anticipated. So now we're having to open up a slug account for that. And that takes a lot of work and time too. So I think for me, I just want everyone else that's not a part of this day-to-day that's happening right now to know that there's a very thoughtful process with a lot of team members in there. And they're also wonderful to work with. So I want to thank the Board of Finance, both the director, Marcos, and your guys' team. I want to thank Luis and his team. It's so smooth. It runs like a nice, I don't know what runs nice, but something that runs really, really nice. And then my team, because it takes all of them always talking and conversating. And I know there's a lot of others involved, but those ones are the ones that are directly related to me. So I just wanted to let the board know we're in really good hands with our teams and staff, and I'm grateful for the hard work.
Thank you, Treasurer, for mentioning that, all the work behind the scenes there, and I am too. I'm grateful that we do have the December sale that can take place, especially for those projects that don't have to wait, that we can catch them in December and move forward with it.
Yeah, Lieutenant Governor, members of the board, I appreciate the director's foresight on that. Also, that is not a practice that we've been accustomed to doing. As you know, in years past, we funded all of the GO bond projects with one issue. Mostly because it can save money to do it in a consolidated way, but here where we have concerns about spending down issues and arbitrage, as the treasurer was mentioning, we thought it was prudent to split it out and make sure that the timing matches up with the need and the ability to spend proceeds.
Any further questions or comments? Anyone?
Is there any main reason why some of those projects don't go through so that we can kind of see a pattern or something?
Lieutenant Governor, Member Lujan, I will defer to the director on this, but my impression of that was that for several of them, particularly the senior citizen facilities, are subject to numerous buckets of money from prior bond sales that hadn't been spent down sufficiently yet. And so to give them more money was concerning about meeting the IRS requirements for timely spend down of bond proceeds. So we needed to get a level of comfort about what their plans were to spend the money they already have before giving them another tranche of money for these projects and to make sure that we line up the timing with the need essentially. But that was, I think, the largest driver. There were also some projects that were just simply had not even begun the planning phase and needed some time to figure out what they were actually going to do with the project and give us a sufficient description of what the need is so we could see whether it was appropriate for tax exempt bond financing or not.
And then moving forward, is there a plan in place to kind of vet those, so that doesn't occur?
Lieutenant Governor, Member Lujan, yes. So we have, in addition to our normal due diligence process, we've enacted enhanced due diligence where we've actually gone in and requested additional information, increased our communications with the agencies to let them know what the expectations and requirements are. And then with the bonds that we are selling now, you'll see there was also not something we haven't done before, but in recent years we hadn't seen was the ability to refund the bonds after 5 years to call them in case there were problems with arbitrage or spend down requirements so that we could be in a position to get that tax exempt debt off the market and avoid any negative implications with the IRS. And I believe that we have a few other items that we are planning on implementing with the agencies to address those concerns. And I'm sure Ashley can just fill you in on those further.
My name is Mr. Chair. I mean, to your first question, Lujan, on why money gets held or expenditures get held up, that's the burning question. And it varies. There's a lot of reasons for it. They're very unique to different circumstances. In the situation of some of the senior centers, there's been a lot of staff turnover. There's been other things like that. But it is really unique to each individual project in each situation. So, and it's tough because I think DFA staff that lead capital, LFC staff that lead capital are trying to figure out how we can ensure that money is moving forward pretty quickly. At DFA, I won't go into it in too much depth here today, but I think it's something we'll be presenting on probably in the next 6 months to a year. We are implementing significant improvements into our IT systems to allow for vetting of projects, but also to make it easier for oversight agencies and local public bodies that are receiving funding to be able to utilize that system to better plan their projects, to make sure they have timelines in place. DFA General Counsel George Hippolyte, who's with you today, has been instrumental in that conversation recently as well on how, what we're doing to sort of ensure oversight is also being implemented to assist these entities in moving the money in the way that they need to. So there's a lot of really exciting enhancements happening at DFA. And so I look forward to at a future date being able to present on that more thoroughly. It's sort of grounded in new IT systems that were pretty antiquated, but it goes beyond that. And it's going to essentially, the goal is to have an entire capital system that from start to finish of planning prior to a legislative appropriation all the way to the end carries the project, carries the entity, carries the oversight through seamlessly.
And Lieutenant Governor, Member Lujan, if I can add to that, and although it's only one project, the magnitude was fairly large, $40+ million for one particular project, which was the UNM Humanities Building at UNM. And it's not that it wasn't ready. It's just that project had both general obligation bond, an appropriation, and a one under the severance tax bonding program. So they had agreed to receive the general obligation bond proceeds and then wait till the next issuance to consider having the second tranche funded, just because they were going to have sufficient monies for their needs for the next at least 6 months.
Point of clarification, is that the 52 million that's in here right now, or is that, it got stripped?
That got stripped from from the severance tax fund, but it is in the general obligation.
Any further questions? Any additional information from staff?
Mr. Chairman, thank you.
We'll go ahead and entertain a motion for item number 21.
Motion to approve.
We have a motion approved by Treasurer Montoya, a second by member Travisani. All those in favor, signify by saying aye.
Aye.
Those opposed, nay. The ayes have it. It's been approved. And we'll go on to the last item, the bonding. That'll be item 22.
Lieutenant Governor, members of the board, speaking of general obligation bonds that we've recently sold, you have before you the final term certificate for those bonds. And as you'll recall, as we've discussed before, the board delegated to Director Leach the ability to set the final terms for those bonds, so long as they were within the parameters set forth in the authorizing and delegating resolution. And as I mentioned, on June 4th, we priced those bonds. The director completed the final term certificate, which certifies the compliance with those parameters, and as is required by the Supplemental Public Securities Act, it is being presented for your information, and to satisfy the requirement of that statute. You should have that certification in your electronic agenda, and I'm happy to answer any questions the board may have, but this is largely just an exercise to make sure we satisfy that statutory requirement.
I'm just looking for it on the electronic agenda.
Oh, okay. Should be page 1084.
If you'd like, I can go over some of the major terms of those bonds.
I think it's okay. I just wanted to find out. Are there any questions from members from the board? Treasurer Montoya?
Just one comment for the board. You'll see the rate of 5%, and then there's one that's 7%. I just want to point out, it had a yield of 2.87, the price of 118.022. Tax exempt bonds are issued with premiums priced over 100, so that the bondholders don't have to be concerned with capital gains. The other maturities are 5% coupons and have the premium as well, but the longer bonds are callable on 3/130. So they should be able to be called and matured at the same time unless the rates are higher. So just wanted to make sure and have that on the record, because I saw it and I was like, oh, wait. That's the logic.
Thank you for that clarification. Any further questions or comments? Seeing none, any further additional information from staff? I'll go ahead and entertain a motion.
Motion to approve.
A motion to approve by Treasurer Montoya and a second by member Cassidy. All those in favor, signify by saying aye.
Aye.
Those opposed, nay. The ayes have it. Louis, thank you again for the presentation.
Apologies for the interruption. I just realized I wanted to, before we wrap up bonding programs, I wanted to introduce Dan with the TAF firm. Dan Upperman has joined the TAF firm. Many of you, I think, know him from his role at NMFA, but he has joined and is helping, not helping, he is part of our tax council representation. So I just wanted to take a moment to introduce him. Thank you.
Thank you. Welcome again. I know we spoke last meeting. Welcome again. Thanks. We'll go on to the next item. We're going to go into higher education. That's item number 23. University of Metro request approval of acquisition of real property.
One, yeah, just finish. It's.
Morning, Mr. Chair, Lieutenant Governor, and members of the board. My name is Lena Chavez. I'm representing the New Mexico Higher Education Department. Thank you for the opportunity to present today. I also want to thank Director Leach and her team for working with the department and higher education institutions to clarify questions that the board members had on our submissions. I also want to thank the board for the approval of the item on the consent agenda this morning. So item number 23 is a request for approval by UNM for the acquisition of real property located at 550 Lipua Parkway on the Maui Island, Hawaii. This item was presented last month to this board and is now being heard for approval. The New Mexico Higher Education Department approved this project at our May 13, 2025 capital outlay committee hearing. This property is home to the Maui High Performance Computing Center and was constructed in 1994 and managed by the Air Force Research Laboratory as part of the Directed Energy Directorate. UNM has a master lease and it is subleased to the Department of the Air Force. The building is 31,337 net rentable square feet and the purchase is $9,165,000. As you may remember from the presentation, this acquisition has some unique features regarding a trust and how the funds are going to be relinquished by the trust to UNM after the purchase is complete. Given the complexities of this acquisition, I'm going to turn it over to Tom Neal, UNM's Director of Real Estate, and his team for more information and to answer any questions.
Thank you, Tom. Welcome.
Thank you, Lieutenant Governor, members of the board. I'd like to introduce the team that's gonna help put this transaction together. Justin Horowitz with the Rody Law Firm, Christine Landavazo with our University Counsel's Office, and Leah Murray, Associate Director in our Real Estate Office. It's okay, I'd just like to, just a brief overview of how we got here and some of the details of this transaction from the inception. Back in the mid-90s, our UNM Center for Advanced Research Computing won a federal award to establish the Maui High Performance Computing Center. We entered into a lease for the existing facility with the prior owner. And that owner sold the asset using certificates of deposits, certificates of participation. And those certificates were held by the Bank of New York Mellon as trustee. We entered into a new lease, a 20-year lease that had annual renewal options. In the event that we lost funding for this program, we had the ability to terminate the lease. Shortly after 2000, when we entered into the lease, the University of Hawaii won the award, and we subsequently sublet the improvements to the University of Hawaii. It was essentially a pass-through of the lease rate that we paid under the master lease to the trustee to service the bond payments. And that agreement or that arrangement lasted until about 2013 when they lost the award. Private defense contractor won the award. That award was appealed and the appeal was upheld. There was about an 18-month period where there was not a occupant paying rent. We exercised our termination notice. The entity that insured the certificates raised the issue about impacts on our credit. Those issues were reaffirmed by our bond counsel. During that period, we were fortunate enough to get a lease back in place with the federal government to continue operation of the High Performance Computing Center. All the past due rents were paid. And then we have continued on with relationship with the federal government on behalf of the U.S. Air Force since that time. We're in the last year of this lease. The lease expires June 30th, 2025. We have a balloon payment that we just made, approximately $1.7 million. That was our last payment under the terms of the agreement. The last year payment was higher than the typical payment. It's been averaging about $1 million a year. The current occupant, federal government in there, pays about $868,000 a year in rent. So there's a little bit of gap in this last year. There's two documents besides the master lease. There's also the indenture of trust that governs the our occupancy in the building. The lease defines a purchase option of $9,165,000 that was available to exercise in June of 2010. And then the indenture of trust really defines the financial terms by which the rent payments are used to satisfy the certificate of participation holders. And then it also defines what happens at the end of this agreement. We were named a residual beneficiary of the trust. So when all the terms of the lease agreement and the indenture are satisfied, the value of the asset is returned, is conveyed to the university. And that's the value of real estate and any funds held in trust by Bank of New York Mellon. We've estimated that the net value of this transaction to the university is $6,765,000. That is the sum of the value that's held that'll be held in the supplemental reserve account, plus the value of the real property. And there's I think there's a few items that I'd like our council to address. One is the supplemental agreement that defines the process by which we purchase the asset. And then we wanted just to highlight an issue with the type of deed that the trustee is willing to convey.
So we do that, Governor, board members, good to see you again, Justin Horowitz. So we've got, and the staff has received in your packages, a form of supplemental agreement, which is intended to essentially put meat on the bones of the purchase option that is sort of sketched out in the lease document. The lease document describes the right for the university to take down the property at the end of the lease, but doesn't really lay in the mix. And so we've got a form of document that puts in the type of mechanics you expect to see when those purchase transaction, purchase option transaction. We presented that document to the trustee. We've had a round of comments. We look to be very close in where it will land and understand that acceptable form and assigned form ultimately, if the board decides to act favorably, would be a condition that the approval that's the deed there's the trustee here took title as part of the transaction, took title to the property for the benefit of the university in structuring the transaction. The university in structuring the purchase option requested and presented, of course, the applicable rules and asked for a general warranty deed for the delivery of the property back to the university. The trustee, as was sort of anticipated in light of sort of the experience with trustees, doesn't want to take any risk in the transaction, and is a matter of corporate policy requiring a quick claim back to the university. I think their position in back and forth discussions is they help the property for the benefit of the university as part of the financing transaction. We're not your typical owners of property, don't understand the history, haven't done anything with the property, and the property been occupied by the university or its tenants over the last 25 years. The university will get title insurance and as part of the closing of the transaction. And so one of the requests as well of the board would be a specific waiver of the rules as to the type of deed that the university will receive with respect to that project property.
If I could just add a couple more comments. The purchase price, essentially, we would pay the $9,165,000, and that amount would be returned to us post-closing when the assets of the trust are conveyed to university. The other thing I wanted just to highlight is there's a continual occupancy by the federal government. We're in the final stages of negotiating a lease that'll take place if the board approves and if we close this transaction. The government will enter into a lease for 1 year with 3 annual renewal options. They went through an appraisal process to determine fair market rent. That amount is $992,000. We anticipate that the federal government will stay in the facility for at least 2 years. The Air Force has acquired an adjacent site and is building a replacement facility. They're just going to start construction here in the near term. So we're very confident we'll at least have that revenue stream coming in for the next 2 years. The university is going to evaluate our strategy and our options on how to maximize our profit, but also manage any of the downside risks. So once we close on this, we'll work closely with the administration on exit strategy and how best to handle the revenue that's generated from the asset. But I think that's that's our presentation and happy to stand for any questions.
Thank you for that. Any additional information from any other presenters?
I think one thing to add on the deed is that, just to let the board know, we did engage local counsel in Maui to help us with title issues and any specifics to the real estate, laws in Hawaii. And so we are comfortable with our counsel there, confident in their advice that they're giving us regarding title and knowing that we need to wait for them to take the good deed.
Okay, thank you. Anything else from higher ed? Any other information? How about questions from board members? Any questions from any of the board members?
I do, Governor, thank you. Thank you, Mr. Neal, and the presentation team. I have a question about cash outflow that UNM has had to incur. You mentioned the bullet payment and the final maturity of the COP, I guess. Are you out, is UNM out cash on this?
We are at a little cash over time. And so, when we lease the asset to University of Hawaii, it's just straight pass through of the lease payment. And that continued to about 2013. And, between, 2013 and the present day, there was a little bit of gap annually, and that gap, ranged from 6,000 to about 13,000, and it bounced around over the last several years. The biggest gap is this last year, the balloon payment, the $1,670,000 versus what the government pays. And so we would satisfy that gap with the proceeds that we received coming back from Bank of New York Mellon.
Great, thank you. And is there any research being done by UNM in connection with this facility, or is that over now?
That's largely over. Yes.
Great. So we come out net ahead. And then as described at the last meeting, the plan would be to probably dispose of this site if it's not leased in a manner where UNM is made whole.
Lieutenant Governor, remember, Kat, that's correct. Yes.
Thank you.
Everyone?
Thank you, Lieutenant Governor. Is it, that the lease will be on a triple net lease, so they'll be responsible for all the rest of it, but we're still gonna cover our own insurance on it?
Lieutenant Governor, remember, Lujan, that's absolutely correct. It's a triple net lease, and it has been throughout this entire term. The new lease with the federal government will be triple net.
Everyone, go ahead.
So the piece of property that we're looking at, because it's not up there, is it this piece right here, just this little square?
President Montoya, that's correct.
And then, can you just remind me, because I stepped out at the beginning, what did we purchase, what it was the purpose of this at the beginning, before all of this?
It was to establish the Valley High Performance Computing Center. It was a federal award that our Center for Advanced Research Computing won back in 1994.
And you mentioned downside risk. What would be some of the downside risks you're referring to? Especially, I know for sure if the federal government doesn't lease this property after the 2 years, that would be potentially one, but what are some of the other?
I think it would be the holding cost associated with a vacant building. If we lost the lease, I think we would pivot to a sale immediately. And so really the downside risk is maybe not realizing the returns that we had hoped and expected for. But as far as a loss for the university, that seems very remote.
Governor, does there seem opportunity if you're not able to have the federal government lease this property, that there would be other entities, agencies that are interested in it based off of location or what's within the building?
We've received inquiries from the University of Hawaii about locating in a facility or leasing it or potentially purchasing it if the federal government vacates, if and when federal government vacates the building.
And what's the risk or the loss if this isn't passed today?
It's a good question. Missed opportunity for the university to to generate revenue and value that could go back to support the university. We are named a residual beneficiary of the trust, and I don't know you guys given that much thought or have an answer to that?
Yeah, well, I think, at a minimum, if this is delayed or is not passed, there will be additional legal fees, complications in terms of, figuring out what that lease document intends for the property, where I think, the folks who drafted at the time expected that property to come back to the university at the end of the term. There's not a lot of guidance about what's next, but so there'll be some, discussions among the trustees of the university about what to do, how to work that out.
Thank you, Governor.
Thank you. Any further questions? Seeing none, any additional information?
Mr. Chair, members, I would only mention that we do have a contingency on this item, so if approved, approval would be contingent on the directors and council's receipt and review of a revised and fully executed supplemental supplemental agreement to purchase option, a fully executed quitclaim deed, and receipt of a copy of the title commitment.
Okay. Seeing no further discussion, I can entertain a motion with the contingency. So motion by Member Cassidy, second by Treasurer Montoya. All those in favor signify by saying aye. Those opposed, nay. Senator Sanchez, vote yes or no.
And may I explain my vote? The only comment I want to make is for the individual who wrote to the secretary, I want them to know that the secretary did inform us and we did get an opinion of legal counsel. They were heard. And so I just wanted to make sure that was on the record that the secretary did inform us.
Just to be clear, secretary and secretary.
They're nice, handsome, good-looking guys. And you're the best.
Thank you. We'll go on to the next item. Thank you for the presentation.
Email them that they're gonna get done. Some customer.
We're gonna go on to the next item. That's gonna see item number 24, new 911 program.
All right, thank you, Lieutenant Governor and members of the board. My name is Stephen Weinkoff, here on behalf of the 911 Bureau within the Department of Finance and Administration, Local Government Division. Presenting on the FY 26.
Let me turn them off.
Presenting on the FY 26 budget. Do you guys have the packet in front of you, the request that was submitted? Okay, I apologize. It's mostly a bunch of numbers and spreadsheets. I'll try to provide some context along the way. The request in front of you is for 36 grantee budgets for 44 primary PSAPs, public safety answering points throughout the state of New Mexico. The request is for $26,426,985. And this budget request is based on a 911 surcharge increase to go into effect July 1 of 2025. That increase will be taking the 911 surcharge from 51 cents to $1, which is a 96% increase. The request as a whole is very focused on our primary mission of the transition to next generation 911. A few of the big budget items in the capital budget for the implementation of the EZNet and Next Gen Core Services, as well as call handling equipment configurations, have been submitted in previous budgets. And we are fast approaching go live on our Next Gen 911 system, scheduled for July 15th of next month. But just to get into the nitty gritty here, if we want to look at the statewide total, I'll just run through quickly some of the budget line items. Under capital, we have E911 equipment upgrades. The majority of this is call handling software updates and configurations for the new EZNet as a part of the Next Gen 911 system. Over the past year, we, through our contractor, conducted interoperability testing with the new core services system and each of the call handling equipment types around the state of New Mexico. And subsequently, that led to getting everyone to the proper software version, and then doing the configurations for firewalls on the network. Second line item, Next Gen 911 EZNet Core Services. This is deliverables 2 and 3 with the DFA Motorola contract for the implementation and transition to Next Gen 911. Those 2 deliverables that we expect to be completed by the end of this fiscal year is the completion of the EZNet network itself. So we're well over 90% of PSAPs that have their circuits installed, turned up, and tested for that go live in July. We have a few outliers with special construction. Those are indicated on a separate spreadsheet here. And then deliverable 3 would be pre-production testing. So as a part of that interoperability testing, actually going on site to each PSAP and then doing a number of testing on the new network. The third piece on this is dispatch software. And this is more something that we are going to deliver with the increased surcharge and expand kind of the cost categories that are currently eligible under the 911 program. So these features are, they support AI-driven call transcription, real-time translation, video feeds, enhanced analytics, and quality assurance tools within the PSAP. And that software sits and integrates various sources of data from the PSAP and their call handling equipment primarily. So that model of what we're implementing is more of a software as a service model. So it's a little bit lower of a one-time capital expense. And then you'll see the recurring expense for that dispatch software, kind of around $3 million, which will be ongoing. Now, most of those contracts are signed for a 1-year, 2-year agreement. This is new software. We've seen the majority of PSAPs opt in, as I would say. We do have a few outliers who are not taking advantage of this software at this time, but that opportunity has been presented to every local PSAP. And there are multiple vendors that are available for them to select from. The other piece of the capital budget is logging recorders. We have a handful of upgrades. We just completed in partnership with the State Purchasing Division, we established a new statewide price agreement. And then so we've seen some activity in terms of PSAPs looking to upgrade their logging recorder systems. And then lastly, we have UPS generator at $472,000. Majority of that is carried over from previous fiscal years where we're just waiting on some local PSAP construction to be completed. Moving down, we have the recurring network managed services. I just want to draw your attention to the E911 voice network. That's budgeted at just over $2.7 million. This is our legacy E911 network that is being replaced by the next generation 911 network and EZNet. So over the period of 6 months from the scheduled go live in July through January, we will be disconnecting and terminating that network and those accounts on behalf of our local governments. So during that go live to total system completion, we will see kind of a dual provisioned call handling equipment where they're able to receive 911 calls through the legacy system and through the new EZNet next generation 911 system. And a part of that, what's happening is under that transition is how originating service providers and wireless carriers, for example, how they're delivering 911 calls into the state's 911 system is a transition that's also happening over that period of time. We have basically a full year, fiscal year's worth of budget for next generation 911 EZNet and core services outlined here. That does include our next phase of EZNet build out. So As I stated, we're well above 90% completed with the EZNet build out, but we have authorized at the division level a tertiary network connection for every PSAP that's going to utilize either Starlink or LTE to try and mitigate any lack of network diversity in that last mile or into the PSAP, right? So majority of our EZNet circuits or network is 2 MPLS type connections delivered through Verizon or AT&T, but we do have to rely on the local carrier and whether or not they have diversity in that local loop or into the PSAP building itself. The last piece, just to circle back to the spreadsheet in front of you under recurring network managed services is wireless cost recovery. I won't get too much into the details there, but as we transition to the new system and the various rules under the FCC, we don't feel that that'll be an expense moving forward once we make the transition. And then we have the dispatch software that I alluded to before. We have system maintenance. Now this is system maintenance on the 911 call handling equipment itself. This funds, your annual software licenses, on-site response with the technician, things of that nature. There is a little bit of contingency in that budget. We built in probably about a 5% buffer just in the event that we need a technician to go on site, kind of outside our scope and to assist with the next gen 911 transition implementation. And then lastly, we have services and training. This is kind of pretty standard stuff for training, minor equipment, GIS. These are more reimbursable categories that will reimburse our local entities for the necessary 911 related work. And then for 911 consulting, we do have a ID&B contractor on board for the Motorola project. That's a PCC requirement, and we're going through that process with you and the PCC board. And then GIS consulting is a lot of assisting the state with the collection, aggregation, and translation of GIS data from our local entities into our state database, which is used for the spatial interface and all the mapping systems within each PSAP. So trying to go quick for you guys. The next page just gives a summary by grantee, kind of by county. Within those categories, gives you a grant total for each grantee. The page following that, we'll get into just kind of more of a capital focused spreadsheet. As I stated, we do have some previously authorized capital under call handling equipment. Won't dive into the details. I think we covered most of that with the statewide overview. I guess I'll just note that under call system in that first column, we do have some costs built in there where we may not have had an actual request letter from that local entity, but we are aware of at least 3 to 4 PSAPs that are physically moving into a new building. And so we're trying to plan to account for any costs associated to the movement of that equipment and configuration at the new site. My next page here is specific to the DFA and Motorola contract for the implementation of Next Gen. As I stated, we expect to complete April 2 and 3 by the end of this fiscal year. Deliverable 4, successful go live, where we set first 50% of PSAPs go live in July, followed by subsequent completion. And then we have our special construction listed there, the tertiary EZNet links that I've mentioned before. And then last page here is just probably one of the most important is looking at the 5-year budget projection, just showing the projected increase of 96% in surcharge revenue in FY26. And And then I guess just some good news to share. I mean, looking at surcharge revenue for FY 25, we used a 3-year historical average for that projection, and projection listed there is 13.1 million. You know, I just got last month's May distribution report from Tax and Revenue yesterday. It was a very large distribution, so it looks like we're getting caught up, and so that pushed us over $13 million in revenue for the year to the 911 fund. Other than that, you know, we're looking at moving some of funding that, or, you know, some project money associated with the implementation of next gen, you know, kind of into the budget next year. So last year at this time, we were projecting a fund balance closer to 2 million. And I think just being able to use projected revenues in the next year, we're looking at a projected fund balance of 5.8 million. So much better, healthier fund. We are looking at a potential new category for CAD. And we're doing some of the legwork now to develop that budget in terms of how we support that. The agency is going through a rulemaking process to allow for that. And so we hope to kind of come back and right size the budget in terms of how we're going to support CAD as well, computer-aided dispatch systems, later on this year. But as of now, that's the budget. Thank you for allowing me to elaborate a little bit on some of the statuses on where we're at with the next gen project. And at this point, I stand for any questions.
Thank you for that. Any questions from members? Member Lujan?
Thank you, Lieutenant Governor. A couple quick questions. Do you have a contingency plan in case when you cut over, something goes haywire and it doesn't work?
Yes, sir. So, you know, the main contingency plan is that it'll be dual provision, but we are going through the interoperability testing ahead of time, and then the pre-production testing at every PSAP prior to cut over and go live. So, you know, if it doesn't work, it should just fall back onto the old legacy system.
Okay. And then the next one is, will this put us on par with the rest of the country, ahead of the rest of the country, or are we still lagging behind the rest of the country once this is implemented?
I'm very excited. I think, you know, we've been behind in terms of the 911 implementation. I think you've seen some uneven, some different styles of implementation of next generation 911. And I'm pretty confident that we're going to kind of move to the front of the pack here, and be an example for other states to follow.
Thank you. Member Tripson?
Thank you, Lieutenant Governor, and thank you very much. This is more of a curiosity, but I would think like emergency response is so vital. Yet so much of the very, very rural parts of our state don't have access to wireless, but could use it for so many reasons. And I'm thinking like telehealth, and I'm just curious about the influence that you have, and you alluded to it, but over like implementing something like a, you know, Starlink, which can reach the really rural areas, but it's expensive, you know, or ways for people to access. 'Cause the biggest concern I always have is somebody doesn't have a phone and they don't have, you know, like, how do they get you to respond? How do they get 911 services? And then beyond that, there's so many other things that are tangential that they could benefit from if we could get a more integrated system.
Yes, thank you, Member Trevor, members of the board. I will attempt to address kind of the overarching question here. And, you know, first, I just want to say that the way we distribute funding, the way we manage the 911 system is very equitable statewide. You know, every county, for the most part, is funded. You know, their one primary PSAP is funded, and they get the equipment they need. Now, we do have a lot of rural areas in the state where cell coverage can be a problem. And I think the private industry is attempting to utilize some satellite technology in an SOS type of mode to make that 911 connection. Now, in terms of how we're building out the 911 network to ensure that it is reliable and you know, if, as long as you have that coverage, that 911 call is gonna get delivered to a PSAP. I think there's a couple of things to consider. One is the design of the network itself, the ESINet, and putting in, you know, two diverse internet connections, essentially what we're using, from two different carriers provides some level of reliability and diversity. When you add a tertiary network that's not as reliant on, you know, a middle mile broadband network or a last mile fiber connection, then that also helps make the system more reliable. But there's also, under the new next gen system, we'll be implementing a policy routing function, which, let's say there's a fiber cut, PSAP A goes down, well, we will have built in kind of that rollover policies in place that if PSAP A is down or busy, that call is going to PSAP B, subsequently PSAP C, up to 4 or 5 iterations, to ensure that 911 call is answered. And hopefully, as we expand into some of the dispatch functions of the PSAP and look at the total, you know, kind of chain of public safety communications, we can address some equity, some of the equity in terms of some of the dispatch functions as well.
How long are both systems gonna be running for?
Thank you, Treasurer Montoya, members of the board. The goal is no longer than 180 days. And that's 180 business days, so it's roughly 6 months, looking at July 15th to the middle of January. We are in very close communication with our contractor and looking at the cutover plan. And there's a lot of moving pieces with that, but we're also going to be working with our IB&B contractor, kind of as like that third partner to ensure that we understand from our new next gen 911 provider exactly when we can start disconnecting those circuits. At that time, we'll put in, you know, a 30-day disconnect notice or letter. So we think that we can start disconnecting PSAPs as they go live and that OSP traffic is switched over to the new system. And then as kind of safeguards within that, in our contract between VFA and Motorola, we have some SLAs in place. And there are some penalties if that 180-day timeline isn't met. So that does safeguard us in some form or fashion, but you know, hopefully we can get the majority, and we maybe have a couple outliers to do with timing of readiness with special construction. But we're fairly confident we can get that 6-month timeline and disconnect that.
Governor, I'm sure you probably went out to an RFP or something like that in this process. What made you guys select these people over any of the other folks, and how many of these transitions have they already done? So that you could try to see if it really does add up to that 6 months.
Thank you, Treasurer Montoya, Governor, members of the board. We at the DFA conducted an RFP to select a single contractor to kind of manage, one, the transition, two, the core services, which is kind of more of the 911 call routing functionality, and then three, the ESINet, the network. And it was a competitive procurement. I think there were a few things that separated Motorola, one being the majority of our call handling systems within the state are Motorola based, and there was some level of integration there. Two, how they would work with us in terms of making the transition to location-based routing or based on geolocation, and how we would work with them in managing our GIS data within the spatial interface was attractive. they've been successful in some regional and county level deployments. Motorola has, for this specific offering, the core services, manages the state of Utah. And what the state of Utah reported on was a drastic reduction of call transfers between agencies. So they were kind of showing a use case where the call routing accuracy was very good. And I think the state of Idaho just selected Motorola as well, and will be implementing it in their future.
Okay, and Governor, I noticed the 911 surcharge increased from 51 cents to $1. I think I recall correctly that it's because it's been many years.
Yes, that is correct.
Go to that.
It's never been increased since it was created in 1989. And if you look at the FCC report, they do an annual 911 fee report. We were one of the lowest surcharge in the nation. I think by putting us at $1, it kind of puts us close to a national average, but still below average on a per capita basis.
And then last question, Governor, we all know we have a lot of rural areas, and I remember as a county treasurer when they were doing our upgrades for E911 in Sandoval County, it was so complicated. Because of the tribal communities that we have and then the rural areas that we have. I saw all the letters, I read through them from the different counties, so it looks like everyone is covered. But as you're integrating, it makes me feel a little bit better. Motorola has already been in these rural areas, so they know what they're up against. But are you guys factoring that aspect in potentially too, that if something fails, I don't know what this software system is, or if it's through internet, or I'm not that techie, and I really don't want to know. I think this is how it feels when people look at my tax stuff. It's a lot, but can you just tell me or reassure me that somebody's looking at this idea that if the rural area, the tribal area is going to still have access once we completely upgrade to this new system?
Yes, thank you, Treasurer Montoya, Governor, members of the board. I think we're very proud that we support tribal PSAPs, and especially, I think looking at the development of a new PSAP in Sandoval County that could better support the rural areas. I know for a fact that the county is working on some addressing projects, and we're supporting them in developing some better GIS data for a couple of their tribal communities. And that's exciting. And then I think if you also look at, I think, even in addition to what we're paying out of pocket here, but some of the special construction to deliver an SNES circuit to these rural areas is something that we funded. And maybe that's putting a underground conduit or a new fiber entrance into the building. Some of the things that we've incorporated as part of this project to ensure that we're not just accepting an alternative measure for their network connection or best effort. We're actually trying to deliver something comparable to the other areas of the state. And then when you mentioned the letter, a lot of that's for the new software that we're funding. And the majority of that is going to be done through a couple different vendors, but one of them Prepared 911, and they're really up and coming 911 focused company that I think is going to be able to provide that level of equity in terms of access to technology in all our rural and tribal areas. So I know we have at least 2 tribal PSAPs opting in for that software. And I even brought a technical expert with me today. If you guys want to know some of the technical stuff.
Thank you.
Thank you. Thank you for being prepared. This looks like a very thorough process and a lot of work and a lot of collaboration among a lot of folks. So thank you for the work you're doing. Just the last question, where's the money coming from?
Money comes from a 911 surcharge. It's on everyone's cell phone bill or landline phone bill. So, I mean, I have it right here written in front of me. It's also on VoIP, prepaid phones, things of that nature.
Thank you. Thank you for the presentation. Thank you.
Thank you. Member Cassidy.
Thank you, Governor. Actually, Treasurer Montoya's question just answered my question. At one point in time, there was concern it wouldn't, surcharge would not be put on cell phones, and that's obviously the result now. So everybody participates, phone service participates in paying this cost. So, right, thank you.
Any further questions? Any additional information you have?
Lieutenant Governor, yes, I do have, I want to bring up something. The amount that's included on the agenda, it was a typo. So the correct amount for the request was $25,676,985. And I apologize for that,
Okay, thank you for that. I'm gonna entertain a motion, but when we have the motion stated, could you please state it with the amount that was corrected, please?
Motion to approve item number 24, E911 Program, Department of Finance and Administration, Local Government Division for the request of approval for the fiscal year 26 budget in the total of $25,676,985.
Thank you, Treasurer Corr. Do you have a second? A second by Senator Sanchez. All those in favor signify by saying aye. Those opposed, nay. Guys, have it. Thank you for the presentation and the preparation for the meeting. Thank you.
Thank you, Lieutenant Governor.
All right, we're gonna go on to the emergency funding requests. So we have 4 of them. I know that we've been here quite a while, and I know myself and Member Cassidy have a meeting in Albuquerque at 2 p.m. as well. I don't want to rush anybody, but just want to make sure that people know that having still quite a bit on the agenda. Well, it's still good to see you.
Good afternoon, Lieutenant Governor and members of the board. I'm Wes Hooper, City Manager for the City of Cal. Would like to thank you for looking over this emergency funding request. And thank you to Mrs. Leach for everything you do. You've been very responsive, and I apologize for the way that we answered your questions. It probably added to your workload. It was not the way we usually do business, but thank you. This request is for $500,000 for a screw press for our wastewater treatment plant. The city of Jal has seen exponential growth in the last 7 years. We're kind of the doorway to the oil